So this process has been done, and why we repeat after the 6 weeks? The reason is this physiological and functional recovery of the vaginal mucosa includes 3 phases. In the phase one, means once we have done the laser process, within 48 to 72 hours, there is a early thermal effect will be there, and this early thermal effect leads the edema, release of the chemical mediators, shrinkage of the collagen and elastic fibers. So first 48 hours, but yes, these patients can come in the OPD, get done and go by that. Very rarely there slight water discharge is there, but it starts in following the 30 days. This called the proliferation phase. So, and differentiates are formed. Next phase is the phase 3, that is after the 30 to 40 days. That phase is called the remodeling. So, mature collagen fibers will be there, increase of the collagen fiber strains are there, neovascularization and new blood vessel formation will be there. That improves the lubrication and vaginal pH and flow. This good healthy bacteria will be there, and that leads to the proper lubrications and normalized vaginal pH will be there, and this forming the normal pH, because in atrophic pH what happened, the pH is of it towards the alkaline and chances of infection increase. So in cases of recurrent vaginitis, even in the young patients we have tried, and then this is not to be done. Yes, the active infection is contraindicated. Once we are treating these infection, any of the infection, whether it is a trichomonal or the fungal or the bacterial infections are there, we treat first, then you should have a period of normal phase also, and then you do the this. So these are to be used, and that's why these time durations happen. So there are various studies which have shown that there is a definitely improvement is there. So reduction in ICIQ and urinary this scores are improved. Definitely one thing is that the quality of life which we want, that improves. So various studies are there, but still always there is a debate that one laser to another is much better. As we talking about the erbium, this is called on this particularly using its smooth mode. So definitely CO2 is ablative, but with all technology, it is a micro ablative. So there will be no burn. And this erbium has shown the promise as a non-surgical treatment for the stress urinary incontinence by promoting the collagen formation, strengthening the vaginal wall, which can improve the urethral supports and continence. So the all energy-based devices has the same principles by producing the heat, and then there is a formation of the new collagens. So this again is a you call it as a non-ablative approach of erbium YAG laser therapy is considered non-ablative, meaning it doesn't cut or remove the tissue, but rather heat to stimulate the collagen production. So this collagen stimulation, the laser energy promotes the formation of new collagen, and this improved urethral support, and definitely then collagen are there. They support the gives the urethral support. So strengthen the vaginal wall provides a better support for the bladder and urethra, which can help to improve the urinary control and reduces the SUI symptoms. So always we can't say that the patient should be the pre procedure, the symptoms, the scoring should be done, and then post procedure you go. Then we can see that yes, these are patients are improving. Yes, to get the 100% result, it is very difficult. Then another is the radio frequency, which is also Tharviva as a name machine we are getting. So this is a vaginal treatment which used to control the heat energy and is a non-surgical options and treating the stress urinary incontinence by stimulating the collagen production and this tightening tissue, potentially improving the bladder control. In this, what happens? This is the probe of Tharviva. So this radio frequency, they are not emitting this. Yes, not visible emissions are there. They are with the heating. Definitely, they are doing this vaginal rejuvenation. So this radio frequency energy heats the tissue in the vaginal area, specifically the endopelvic fascia, which supports, because the depth is more in case, so which supports the urethra and the bladder neck, and this heat causes the collagen denaturation. So the tightening of these tissue can be helped to restore the support of the urethra and the bladder necks, and potentially reducing or eliminating the SUI symptoms. So again, this radio frequency is one of the process by which the heating is there, and then who helps it there. Since radiofrequency treatment is explored as the non-surgical option for stress urinary incontinence, involving the application of RN energy to induce collagen denaturation in the urethra, potentially reducing the urethral hypermobility and improving the urinary control. So different types of, even in the urge incontinence also can be used, and there are now the probes are available. This, I'll show you this further, that the probes are available which go into the urethra. So there is a one study, new approach to treatment of stress urinary incontinence with a non-ablative transducer. So this is the erbium probe is there. This has been introduced into the urethra. Inside that urethral opening, you are putting this, and this laser is directly coagulating here, and then denaturation of the protein and the collagen is strengthened. So this part is to be improved. So these are the various way to go. It is not very much of use, but still we are using the vaginal probes. So the fight is going on that which laser is good or which laser is bad. Recently, this one of the study has been published, that CO2 laser therapy for the management of the stress urinary incontinence in a woman, a systematic review and meta-analysis which has been done, recently published in the 2023. And in this background, the CO2 laser therapy that has been taken, they examine the efficacy of CO2 laser therapy for the management of SUI related symptoms. And this systematic review and meta analysis randomized the control trials and port study. Four database were used until the January, and they have assessed where the this various treatment and data were summarized as a mean difference with the 95% confidence. So this calculation they have done. What the findings they have seen, that is a 1 hour pad weight, means the lady who was leaking, how much she was leaking. It's a one of the surprising fact that the sale of adult pad is more than infant pad, and this has been given by a company, Procter and Gamble. They are the manufacturers of the adult and infant pads. So these diapers which has been used by the our patients, this study has been even seen that after CO2 laser therapy, the significantly decrease in the 1 hour pad weights at the 3 months, means the how much the leak they, so the amount of leak has been decreased, and that's why they have said that this 1 hour. So if they have the lesser wetting of the pad, definitely they can use much for the longer duration. And then again the cost which is they are paying for these pads, if they are changing every time, it becomes for the older patients, it becomes a very difficult to go and every time to change. So this results are there. Then this therapy that decreases international continent square quotient has been checked. So this SF score has been decreased. So CO2 laser therapy significantly decreased these scores at the 3 months, and definitely they have found that these are the studies which responds that. Then again, these meta-analysis for this PFIQ, pelvic floor impact questionnaires that they have seen, and this they have found that this therapy significantly decreases the PFIQ scores at the 6 months. So these are very promising results, and very enthusiastic results are there. They have done this, and everyone get this got the positive effect, and then trying these CO2 laser therapy in our different conditions. So urogenital distress inventory, these are the scoring that they have done. Again, this has been, they found the positive results in that. Then again, the vaginal health index score, if you're talking about CO2 laser therapy, significantly increases the vaginal health index score at the 6 months. So again, this has been found. So finally, this study, because in this around 16 countries they have cut, but Unfortunately, India has not participated in this study. So CO2 laser therapy improved the SUI related symptoms in women. So only that we are talking about the symptoms. The complete cure, we all know that even by the all surgical procedures, we see that the recurrences are there. So to obtain the solid conclusions, the future study should be well designed with the standardized settings, consistent therapeutic protocols, and the long-term follow-up periods are required to just justify that these energy-based devices are there. Yes, definitely the case selection is the most important thing. It is the grade 1, grade 2 is there. If patients are insisting the grade 3, don't do much of that promises with them. Always say that we will try it. If it is going to help, then definitely we can go. So, with these energy based devices, can we use the all biologicals, PRP, exosomes, and fillers? These are the things I think in the next class you are covering that. So, we have tried because exosome therapy, exosomes available in the market with that ready made form, or the autologous also can be made, but the machine is very costly though. It's I think it is available in very few centers. Fillers, all we know, fillers can be used. So this laser can be combined with this PRP. So PRP, all the next class will cover the whole of the PRP. So this platelet-rich plasma, it has, we all know the growth factors are there. The same way the lasers which we are using, and that is also one of the, it stimulates the body's own regenerative process. So this regenerative process is increased by the lasers. If we add on this PRP, because it is autologous, that can be injected and have a high means amount of growth factors that again stimulates the growth. So this intramucosal injection or spraying PRP, rather we are using this because initially when to do combine this PRP, it should not be applied exactly same time when we are doing the laser. There should be at least a 1 week difference should be there, because we are uh, uh, that time the heat is produced. If you will put that PRP, that will be not effective. That's why this intramucosal injections are more useful. Sometimes the patients are not means very sensitive. Even they are, because we are using this insulin needle, so it's a very small needle, and we are going in a depth very in a 1 or 2 millimeter just into the mucosal part, not beyond that. So this injection sometimes we spread in the vagina, because as we have also seen that PRP in the for the thinning endometrium, where we are using just putting intrauterine and keeping, so that absorption helps in that. So post laser platelet rich plasma therapy may support the healing and neocollagenesis, but that is not immediately. That should be after the 7 days. So that's why I'm putting here. These are the conditions. Now comes that what, so different, what we have seen that behavioral and modification, pelvic muscles, yeah, all biofeed and pelvic floor stimulation we are going. Then this other products absorbent, we have talked about that, how many pads they are using and how amount of that. Medication, definitely estrogen, we know this is the gold standard for the atopic dermatitis that we are using. Sometimes what happened, the lady is coming to us and the vagina is very means introitus is very tight. Because of this, in menopausal patient we have a different probe that sizes are smaller, so that can be used. But I in practically prefer that for the few days we apply the estrogen. Otherwise you directly in these senile vaginitis cases, they have this SUI or with the atrophic vaginitis, if directly start with using these probes, there will be a more and more problem can be occur, and even the patient starts bleeding, because already we know that that thin vaginal mucosa, that is the atrophied mucosa, will not tolerate these energy. So always the pre-medication with the estrogen to be done, and then you start using your energy based devices. So this minimally invasive therapies, injection, radiofrequency treatments are there. Surgery, we all know the midurethral slings or suspension procedures, let it neck. So this pelvic floor training is recommended for women with urinary incontinence as the initial treatment or in combination with the other treatments. So this pelvic floor muscle training is effective in prevention and treatment of urinary incontinence during pregnancy and postpartum. But practically, I said that manually, which we are doing, it is not very effective. Yes, definitely. Now we require in our clinics, there should be a physiotherapists, those who are trained in the pelvic muscle training. So there is a, this is another new one part which can be opted by our young gynecologists, even because they have all knowledge. Or if you have in your center a good physiotherapist, you can ask them, they can go for the training in this part and can start with this pelvic floor training of the muscles. So WHO, European Association of Urology, and American College of Physicians, they recommend the physiotherapy as the first line treatment in the urinary incontinence, which strengthening of the pelvic floor muscles and external and sphincter muscles, then increases the urethral closure pressure and resistance, that improve the bladder neck support. So this we all know since beginning because this has been done. So this is again one machine. Different machines are available. This is because this is the first one machine, and we always think of the safety. Yes, these companies says these are the safer machine. So this is, its name is MCELA. Not I'm saying that various machines are now available. It's a non-invasive, non-surgical treatment that uses the high-intensity focused electromagnetic energy to stimulate and strengthen the pelvic floor muscles, improving the bladder control and reducing incontinence. The one thing is that any of the treatment in the gynae or the pelvic area, that is, you don't require to put off their clothes. They can, with all their braces, they can sit here. There is a probe. They sit and then pick the point, and then can we start the machines. So this is again, yes, FDA approved and entirely non-invasive procedure is there. So this pelvic floor musculature for the purpose of rehabilitation of the weak pelvic muscle and restoration of neuromuscular control of the treatment of the male and female urinary incontinence. So this is can be used in both the sexes, that male, because the male have also this incontinence problems, maybe post surgery also, or maybe in as the aging they have. So high intensity focused electromagnetic technology induces the deep pelvic floor muscle contractions designed to deliver the equivalent to 11,200 Kegel exercises over the 28 minutes of on sitting this chair, with the intention of increasing the neuromuscular tone of the pelvic floor. So the key effectiveness is based on the focused electromagnetic energy in depth penetration and stimulation of the entire pelvic floor area. So I think this should be in there. I think after some times we'll see in our all gym they will keep these chairs, and then they will also take out our part in their labs. So how this electromagnetic technology, this is in is high intensity focused electromagnetic procedure is there, and this rehabilitation of weak pelvic muscles and restoration of neuromuscular control for the treatment of the male female is there. So it stimulates the musculature. So in this way, these muscles are to be stimulated with the electromagnetic energy. And yes, this the why we are talking about the approval from the different associations. The reason being where the safety is required, and we all know everywhere the litigations are there, so we can just explain that yes, these are the machines which has been approved, and that's why we are using. So this neuromuscular these stimulations, which is electric current, depolarizes the neurons, resulting in the concentric contraction and lift up the all pelvic floor muscles. So this maximum volume contractions will be there, supramaximal contractions will be there. So this is the greatest amount, maximum voluntary contractions will be there. So in this way, this all muscles to be contract. So it is not possible that thousands of the Kegels can be done by a patient in a one sitting. So this can be performed. And again, the schedule is that number of therapies should be the 6, and therapy time in one time it is the 28 minutes. And twice a week the patient to be called, and they come and sit on that. And this first protocol is gentle and gradual stimulation of pelvic floor. Again, the energy can be set on that. Exercising with the light weights, muscle facilitations, muscle strengthening, and muscle relaxation will be there. And this possible candidates the patient with the symptoms of SUI, urinary incontinence, and these weak floor, and the post-op rehabilitation also in the postpartum patients. But all these, whether we are going with postpartum training for the vaginal rejuvenation in these, the 6 weeks time is required. Postpartum 6 weeks we can do, and then intense protocol can be followed in these? Yes, the what are the contraindications for, or especially in this case, if you are talking about the electromagnetic, yes, for the laser or the electromagnetic, both the pregnancy is contraindicated. But in electromagnetic, the copper T, we always ask them whether it is there. Then metal implants are there, so the knee replacement and all patients should be there. Cardiac pacemaker should not be set on these. Vaginal prolapse beyond the introitus, yes, it is not going to help you, but yes, now we are trying after the surgery. This correction of this vaginal prolapse, we are asking to do these Kegels. Definitely, these are helping because all the muscles are weakened. So we are strengthening these muscles. Yes, malignancy is always that to be is a contraindicate. Surgical procedure where the muscle contraction may disrupt the healing process. Yes, the post-operative, it is not very early. After 3 months, or even after the 6 months, we can start with these exercises. Side effects, if the proper position is not there, muscular pain may be there, maybe temporary muscle spasm may be there, temporary joint or the tendon pain, local erythema or the skin redness that has been seen very rarely in this. Even in the laser, we have not seen that erythema or redness of there. So there are, the safety has been proven by the different studies. They have done, again, a pilot study is going on. So these all gives the positive results, and this gives us boost to go with these all minimally invasive procedures in our practice. So we can help our patients for going these. So comparison of this electrostimulation for the pelvic floor muscles in urinary incontinence. So other various machines are now in market available, but this electromagnetic is one of the proved machine which is to be used in our patients. So laser plus radio frequency, and plus whether we are going with the lasers or with the any of the lasers, CO2 or the RBM lasers, or we are using the radio frequency for the vaginal rejuvenation and the part of the urethra which we rejuvenate, and add on with these with the Kegels, that can help in improving the condition. Then third part is the biological fluid like the PRP or the exosomes or the other feelers. So this gives a, means this, these are becoming day by day the promising results for that, because the patients are not accepting the treatment, surgical treatments, and these, as all this these meshes has been withdrawn from the market. Yes, few of the companies that Lotus and all, Dr. Vineet Mishra, that he has himself designed this urethral slings and that he is using. Yes, these are not as much of the side effects has been seen by these, but the Johnson has withdrawn all these things. So using all these procedures, these things we can go. So it becomes our responsibility that urinary continence, incontinence patient, they suffer all in the silence. So now it is a time to offer the new modalities, which is a way forward. So we all go with these modalities, we think of that. And I think, yes, everywhere the training is required, go with these subjects, read it, and then to attend all your the workshops and all. And then this types of classes are, I think, helpful for getting the knowledge on that, and different literature available everywhere you can read and experience. And yes, definitely to start with these machines, yes, it is a very costly affair, and try to take the good machines, so the safety should be there. In one of my patient, I found that after doing the lasers, she started having watery discharge, excessive water discharge. And I got scared that if there is any VVF or something has formed. I contacted so many of my colleagues, those who have started using this. Everyone said, no, we have gone through all the literature, nothing was there. And within 3-4 days, gradually the discharge decreased. And then we got that this is not, no chance of having any I mean any trauma on the vaginal wall or the nearest structure like the bladder or the rectum. So this can be safely used for the last 7-8 years, which we are using. Not no any no any complication, not the severe or even milder. Sometimes the patient there, since, because as I have already said, the menopausal patient we starting without correcting that with the estrogen, yes, definitely the problems arises. So thank you very much. One request, because I get this opportunity that I'm contesting for the president election, I need all your support from all your members. And thank you very much for giving this opportunity to present this lecture.
Well, fantastic, fantastic talk as usual. I am sure that the delegates are fully mesmerized by what you have told, because if at all you see the chat box, n number of questions in the chat box. Dr. Alsi, are you there?
Yes, sir, I'm there.
Would you like to take the questions, please? Ask the question.
Yes,
Yes.
yes, sir.
We can start from beginning. I have deleted the unnecessary messages, so you can start with what does incontinence without leakage mean?
Yes, yes,
Leela ji.
yes.
Haji, that is a grade 0. That's why that is the incontinence without leakage. Yeah, that,
पर
yes.
उसका मीनिंग क्या है?
उसका मीनिंग उसमें यही है कि just sometimes the patients are coming with this incontinence, means they are not leaking, that have the feeling of that, and this terminology they have used in so many places. So this is all. Yeah.
Okay. How will you
Okay.
select patients of SUI, whether they should undergo laser or HIFM?
No, that only HIFM is not going to help. Yes, if you have not, laser is have a different mechanism, and HIFM is the different mechanism, because HIFM is strengthening the pelvic floor muscles. Laser is doing the regenerative process. They reach. So this is the collagen is formed, neovascularization occurs. So that gives the anatomical support over there. And this gives the functional support like that, the muscle strengthening, because we all know the pelvic floor muscle should be strengthened than can be. So it is a combination of the thing. Means even the laser plane is used by so many in patients. We are getting results. Yes, adding on this PRP, because everywhere this electromagnetic chair is not available. That's why, and simply that which Kegels which we are explaining. So the first line is this.
Cost of Femilift, as usual, cost of laser machine, and any role in vesicovaginal fistula for laser.
Any no.
फेमिलिफ्ट का कॉस्ट क्या है मैडम? फेमिलिफ्ट
फैमिली जब हमने खरीदा तो 50 lakhs में खरीदा था.
चलो ठीक है. चलो तो अप्रॉक्स 50 lakhs बोलेंगे. उसके बाद एज यूजुअल कॉस्ट ऑफ लेजर.
एज अभी क्या हुआ है कि कॉस्ट ऑफ मीन्स प्रोसीजर.
नहीं मशीन.
Machine.
Machine now, so many machines are available in market. So
Yes.
many China made, Korea made, idhar ka, udhar ka. Then again, you always see the safety point of that, because once that, as I have explained, that in one patient the excessive discharge were there till she has not returned to the back, that normal discharge had the sleepless nights.
Okay.
That's all.
Ma'am, how to check the safety of the machines? What things should we see exactly to know this machine is safe?
One is the company. We have to see who is making this, from which means who is the manufacturer, what they are saying. Then definitely we can try for the demos. So one thing is the manufacturer part. The company which they are coming, if any of the machine costing around, if any machine to be combined, because RBM and all, they have the same rates. If anyone is coming, because in last conference I saw that they have brought a smaller procedure, that one probe was there, you put into the vagina and then it will give them. They were comparing with the electromagnetic this chair. So this probe you are putting into a vagina and then you say that it will compare with the chair. It is not possible. Or the simple probes are there which is not attached with a good console. Then how it can work? So always see that manufacturers, you ask them that their literature, and definitely by this searching the market, and then you can go with this. कोई चीज 50-40 lakhs को कोई 10 में 5 lakhs में देगा तो अपने को लगता ही है ना कि कहाँ पे वो कट शॉर्ट कर रहा है.
ठीक है, तो उसका बॉटम लाइन मीनिंग है कि मिनिमम 30 लाख का लेजर मशीन होना चाहिए.
नहीं, मिनिमम नहीं यार, क्वालिटी होना चाहिए.
नहीं वो क्वालिटी अचीव करने के लिए
क्वालिटी
मिनिमम
अचीव करने के लिए इतना तो लगेगा उसको.
इतना तो लगेगा.
इतना लगेगा उसको.
Right, right.
अच्छा.
Ma'am, what is the role in bedwetting and bedwetting at night? Is there any role of energy-based devices for bedwetting?
Bedwetting in which age group? Definitely. Bedwetting is that involuntary loss, means leakage of the urine is there. So involuntary leakage of urine maybe because of the other conditions are there. maybe the patient, simply the diabetic lady is there, she's having a deep sleep, and when she passes urine, and yes, laxity of that urethra is there, and these are the patient that has to be go with the urological evaluation that may require your even the simply बच्चों में तो हम ये करते हैं, there's some psychological, and usually they give the treatments them कि they are not aware of that, the fullness of the bladder and urge for that, and they are going. So in these patients, sometimes the urge incontinence also, because they are going up to this in the night, they are sleeping, they have, once they get up and think of that going to the toilet, means washroom, before that they leak. Otherwise, in the sleeping conditions, the neurological bladders, and this urodynamics is required to rule out that any the sphincteric means or intrinsic muscles are involved in these cases. So that history part is very important in these cases.
Ma'am, what are the side effects of lasers in SUI?
Side effects as such, if we are not properly, energy has been used, sometimes overheating is done, definitely the tissue damage will be there, more discharge will be there. As I have mentioned that we have not seen any perforation, any means fistula formation. So this is that. And another side effect is that the patient is not getting means effective treatment by that, means failure of the treatment. Or the
Is it
partial, very, very less, 10%, 15% improvement is there only. Yes.
Is it useful for incontinence in women above 75 years?
That if they have the mild to moderate degree of SUI, yes, it is effective. But again, that the vagina should be treated previously with the estrogen, that we have to see. Directly will go, that we will traumatize more and more.
In elderly patients, dry vagina, will they be able to tolerate the treatment?
Yes, definitely. That's, you just you lubricate and then start with that.
Coming to the same queue, how many days of pre-treatment with estrogen should be given in such patients?
So usually 1 month is required.
Okay. Okay. Yeah, Renuka, next.
Yeah. Difference
Sorry
in the
to
machine. Difference
sorry
in the
to
machine
interrupt.
settings.
Yes.
Difference
Yeah,
in the machine settings for pre and post menopausal patients.
Yes, again, that's in different, because we have to just decide how much energy we have to go. Some patients are very sensitive. At setting of the lower settings, means energy you are giving up to the 30 joule. That 30 is not tolerable to them. So gradually we're increasing. So lesser the energy, longer the time we give. I think that is more beneficial for them. So sometimes in a very low setting, also the patient is not able to tolerate that. Sometimes we are putting some local anesthetic gel or anything, but usually we are not giving that. We just see that how much of the energy the patient is accepting, and then can be done.
What is the side effects you have come across?
Side effect, only one thing is that is the discharge, excessive discharge. Sometimes the patient comes with that.
If I have to choose only one EBD, which should be the best? Laser, RF, or any other?
Yes, definitely. If you will ask me that I'm the laser user, I'll say yes, laser is the one of the good options you can use in so many places, and better than RF. That, because it's said that the machine, because if you are going with these machines, they have the different probes. So that's why this branch, which we all call it as a regenerative, functional, and aesthetic gynecology. So functional is that their sexual function is to be improved. Then also in therapeutic use, therapeutic, like one condition means various condition. Cosmetic, if not cosmetic or aesthetic part we are going, then tightening of vulva, whitening of that means color, that is the bleaching of that vulval skin. These are can be performed with the same machine, they have the different probes. When one of the condition, which in various condition, like vulval itching, vulvar itching, even it is undiagnosed remains, or one of the condition, the lichen sclerosis, which have very good use of that. So if you are purchasing any machine, you see that how many functions we can perform. Because to put so much of money in a machine, you need the output also that. So in lasers, we have seen that we are treating these lichen, and lichen, yes, I can see that this is a very good. Even with the machines, they have the cutting mode, smaller polyps we can remove. So that is after this using these by cutting with the lasers by this either the polyps or some micro tags in the, around the vagina, the contraction is not there. As the electrical energy we are using, chances of contraction of the skin will be there. By the lasers, we have that you cut anything, there will be no means contraction of that part of that. So multiple
What is the cost?
pardon? Uh,
What is the cost of Amsela chair?
Mcella, now they are saying around 30 lakhs, but again, all the part of the negotiation.
Yeah. Ma'am, what does it mean by exercises with heavy or lightweight means?
Heavy or lightweight means exercise. So
मैडम आपने एमसेला चेयर के बारे में बोला
Amsela
था
chair के बाद में
U1 sitting and U2 heavy lightweight मतलब the person exercises who exercises with lightweight.
right.
She should not exercise with lightweight on the chair, but a person who is
Okay,
used to moderate exercise.
moderate exercise.
yeah. Ma'am, how do you counsel the patient for a treatment modality?
Yes, definitely. Once you diagnose it, I mean specifically in SUI, rightly said, when I was choosing this machine, so many of my colleagues they said, "अरे यार ले ले हम सबको ये problem है." Till date, no one
Nobody.
has turned up. No one has turned up. Everyone is having this problem, but no one is taking. So even in our fraternity, when we are not coming, the patients that have counseling is required. Yes, no, there is no overcommitment. We can't say that I'm going to help you in 100%. I'll give you 100% result. It all depends on the degree, mild and moderate. These are the right patients to be taken for these treatments. Then again their body tissue, because this the treatment is only giving to the tissue, the body will respond, because the basic principle is that we are stimulating the regenerative process of their own body tissue. So that we have to explain. If anyone is having, if they are coming with the prolapse and tightening of vagina, in case of first pregnancy they're coming with the lax vagina, some are having not even after cesarean they have the laxity, not only this the vaginal delivery, even after that. So these are the, then we have to explain your body tissue is like that. How much they will give response, that depends, because the basic principle is the same for a healthier tissue or the weaker tissue or some this condition. So response is from your body, we will give. So overcommitment should not be there, then the patient will get satisfied. And sometimes we need the more cycles. मोटरसाइकिल देने में अपने को यही अपना जो हिंदुस्तान में जो सिंपल सा ट्रेंड है, ठीक है, आई विल नॉट चार्ज यू फॉर द 6 और 7 साइकिल, यू कम एंड गेट इट डन, बिकॉज वी वांट अ रिजल्ट्स अल्टीमेटली. तो हम लोगों का आदत ही है हिंदुस्तानियों का, हम बोलेंगे, हम सारा कुछ जो है ना फॉल्ट अपना मानेंगे, वो ठीक नहीं हो रहा और हम सोचेंगे कि वो हमने गलती करा.
So can you please go for the next question? I'm not finding it in.
Yeah. I will do that. I will. Are these treatments, especially the energy-based device, HIFM, covered under insurance like surgical procedure?
No, it is not covered.
No, they are not covered. Okay. Many a times there is a condition called as queefing, QUEEFING. That means passing of gas through vagina.
Yeah.
Okay. So any will these treatments help in that?
Yes. In these times, some not of a much of patients, so one or two patients, they came with the means multiple problems, laxity and all, and those who have the laxity, they are coming with that. I'm passing gas through the vagina. They are coming, so they ultimately they have the laxity of that, and these patients are the even if anatomical damage is there. Then sometimes what happens, the patients are coming with the after delivery, they have first degree or second degree tear was there, and that has been non unstitched condition. So this tightening will be not possible. We have, I personally tried that in case the laxity is because of the previous old tears. We have done their surgical repair, and afterwards, because the milder cystocele was there, the vagina was lax, then tightening has been done. इस वो पूरा, क्योंकि वी नीड सम देयर सेक्सुअल फंक्शन टू बी देयर, इट शुड नॉट बी पेनफुल, सो उनका सर्जिकल करेक्शन नहीं करके देन वी कैन एड ऑन दीज प्रोसीजर्स.
Any precautions or instructions before and after HIFM chair treatment?
Yes, all these contain any of the metallic things that is to be taken out. And yes, definitely, if they are sitting and muscle goes in spasm and all, they should report immediately. They should not suffer with the pain and all. So next time, the energy and then their sitting should be properly managed. Means one thing is there. What happens once you put any chair or that, you just your technician is going on that. But if patient is complaining, the doctor should see this.
Okay. Please suggest good companies for CO2 laser. When you said laser, आप CO2 laser mean कर रहे थे या diode laser और RBM like laser?
नहीं सर, लेजर में दो है, ये जो मेन है CO2 और RBM का है.
हाँ.
CO2 वाज जो मेनली यहाँ CO2 आया पहले, वो आया फेमिलिफ्ट एल्मा का आया. एल्मा वाला जो था, दैट इज द CO2 फ्रैक्शनेटेड लेजर. दिस इज इंटरनेशनली अवेलेबल, ये अभी है इसको. दूसरा है RBM वाला. सो CO2 पे वही वाली बात है कि CO2
दूसरा कौन सा मैडम? दूसरा
RBM.
ओटोना स्मूथ.
हाँ, सो दैट इज कॉल्ड दिस. RBM को नॉन एब्लेटिव बोलते हैं, CO2 को एब्लेटिव बोलते हैं. बट इस एब्लेटिव से क्या है सर कि थोड़ा सा इसमें, यदि आप दोनों को कंपेयर करोगे, क्योंकि बोलने के लिए एब्लेटिव में लोगों को ये लगता है कि एब्लेटिव मीन्स इट विल बर्न द थिंग्स, but the technology by which the laser is transmitted to the tissue is so finer because it is alternate. These are the pixels are at the alternate,
पकड़ लेते हैं ना.
continuously going. तो वो दोनों काम कर रही हैं. सो इक्वली गुड, मतलब आप पेशेंट्स, क्योंकि जो जो डिफरेंट यूजर्स हैं, हम आपस में बात करते हैं तो रिजल्ट्स इक्वली गुड मिल रहा है.
Okay. Whether we use HIFM and laser simultaneously?
यस, मतलब हमने लेजर किया, लेजर के बाद में द पेशेंट कैन कम फॉर द दीज सिटिंग्स ऑफ दिस हैव.
After how many days? Say 2 weeks, 1 week?
सर फर्स्ट सिटिंग का एटलीस्ट जो है ना, पेशेंट का 1 सिटिंग के बाद में, क्योंकि एक प्रोसेस जो है वो अपना 6 वीक्स का सर देखना बहुत जरूरी होता है, क्योंकि वो पेशेंट कुछ भी होगा तो कोरिलेट करेगा, मैडम हमारे को ओवर ट्रीटमेंट किया. प्रैक्टिकली इफ यू आर आस्किंग, बिकॉज आई डोंट हैव दैट हाइफन चेयर, आई एम सेंडिंग टू समबडी एल्स जहां भी भेजना होता है, तो मैं ये कहती हूँ कि एक सिटिंग का तुम्हारा कम से कम 6 वीक्स निकल जान दो. फर्स्ट सिटिंग विल सी, आई विल एग्जामिन, एंड नेक्स्ट सिटिंग के बाद में तो बीच में दे कैन कंटिन्यूअसली गो विद दीस थिंग्स.
Okay, in menopausal patients, it can be used?
यस,
Okay,
अपोजिट में था.
yeah. So there is another question.
वेजाइनल रिजुविनेशन के लिए तो बेस्ट ट्रीटमेंट है,
Okay.
बिकॉज ईस्ट्रोजन, वो लोग, सम पेशेंट्स आर कमिंग ओनली विद दैट, आई गेट फेड अप ऑफ दिस ईस्ट्रोजन, वो क्योंकि वो ट्यूब पे ट्यूब लगाना होता है, एंड दैट हील्स वेरी नाइसली.
Okay.
एंड एक रिकरेंट वेजाइनल इन्फेक्शन में भी सर बहुत अच्छा है. जो पोस्टमार्टम पेशेंट्स, दे आर कमिंग विद दैट रिकरेंट वेजाइनल इन्फेक्शन, यस वी आर यूजिंग आफ्टर दिस, मींस 6 वीक्स के बाद ही जाना है, मतलब रादर वी आर 3 मंथ्स 4 मंथ्स के बाद ही उनको करते हैं.
Okay. Now there's a question. Johnson and Johnson initially TVT आ गया, बाद में उस पर बैन हो गया. So will all these machines be, are they safe or should we invest? क्योंकि TVT machine cost 3,500, 4,000, 5,000 करती है. ये तो 35 लाख इन्वेस्ट करके बैठो और बाद में समझ में आए कि ये बैंड है. ऐसे हो सकता है क्या?
सर बैंड होने को बीच में इन्होंने करा था, इन्होंने बीच में इसको करा कि आप विजाइनल उसमें नहीं यूज कर सकते हो. सर वो वर्ड जो कॉस्मेटिक वर्ड आया ना, तो कॉस्मेटिक वर्ड पे करा. देन फाइनली व्हाट द रूट, एवरीवन हैज फाउंड दैट, सबने वो उसमें, कंपनी ने भी हेल्प करा है कि दिस इज फॉर द फंक्शनल यूज आल्सो. एज आई एम सेइंग कि सर लाइकेन स्क्लेरोसिस है, उसका ट्रीटमेंट सिंपली हमारे पास, इवन द डर्मेटोलॉजिकल सोसाइटी ऑफ इंडिया, दे हैव आल्सो अप्रूव्ड दिस फॉर ट्रीटमेंट ऑफ दैट. सर वो कितना स्टेरॉइड लगाएगा, हम गायनेकोलॉजी को तो क्लोबेटासोल से ऊपर कोई दूसरा स्टेरॉइड पता ही नहीं होता है. सो लिवर ड्रग्स हम लोग वहां तक पहुंच के रुक जाते हैं, एंड द पेशेंट्स आर रिस्पॉन्डिंग टू दैट. सो सर ये सब कुछ इधर उधर करा के बैन तो अभी नहीं होने वाला, क्योंकि इतना बड़ा मार्केट हो गया ये, ये नहीं बैन होगा. सर स्किन डर्मा वाले तो सब जगह यूज कर रहे हैं.
Okay. Okay. Before estrogen pre-treatment, any investigations have to be done like mammography, lipid profile, LFTs?
No, one thing is that always the patient we do this pap smear, क्योंकि हमारा अपॉर्चुनिस्टिक है, जब पेशेंट आता है तो अपन पैप स्मेयर तो करते ही करते हैं. यस, इफ पेशेंट इज रेडी फॉर दैट, मैमोग्राफी अपन क्लिनिकली अपन देख ही लेते हैं, बट इट्स नॉट मैंडेटरी टू गेट इट डन.
Okay. Any role in VVF? No.
सर वीवीएफ में नहीं है. वीवीएफ में नाउ द सम पर्संस आर ट्राइंग पीआरपी और एक्सोसोम्स और स्टेम सेल्स, वो उस एजेस पे करके एंड दे आर ट्राइंग ऑन दैट. तो वो शायद सोच रहे हैं कि सिंपली हीलिंग हो जाएगी स्मॉलर वन के लिए, बड़े में तो कुछ भी नहीं होगा सर.
After how many weeks of delivery can HIFM be used? I think you told 6 weeks, right?
हाँ, 6 वीक्स तो मिनिमम चाहिए सर.
Okay. यार ये इंश्योरेंस के बहुत सवाल है. In case of muscle spasm or MCELA or anything, what is to be given?
सिंपल, वो तो मसल स्पैज्म एक बार होगा, थोड़ा सा मसल रिलैक्सेंट दो, उनको समझा दो नहीं है नेक्स्ट सेटिंग टू बी अवॉइडेड, क्योंकि समटाइम्स दे आर वेरी सेंसिटिव टू दिस.
Okay. CO2 or erbium for postpartum infections.
Here, postpartum infection. Yes, erbium and CO2. Yes, sir. This laser is in the recurrent vaginal infection. It is helpful. क्योंकि postpartum में sir क्या, again this is the hypoestrogenic condition. They're repeatedly getting infection. One of the patient, young patient, around 25-30 years, in first pregnancy, means first delivery, she had infection lasted up to the 1 year. In second delivery, again after this delivery, after 6 weeks, she has started, means thoda thoda hota gaya, and next 2-3 months में excessive discharge. So one of my student, he called me कि मैम ये problem मेरे साथ फिर दोबारा, मतलब patient is coming, I'm sending to you. I treated, yes, the active infection treated. I did that vaginal lesion, and that time she completely cured, and uh, she had no infection. So that may be because of this hypoestrogenic condition, and she had history that she means lactation was continued up to the 2 years in the last time. So always we all know those who are lactating properly and all. So that is again the postpartum period is hypoestrogenic. The vagina becomes dry and all. So they are having prone to that. So this laser has helped these. So few studies are available over there.
Okay. Any other questions? Anybody can unmute themselves and ask any questions. Because I think the chat box का questions हो गया है.
Leela ma'am, good evening. Madan here.
Hi, कैसे हो?
Yeah, fine. Just I wanted to ask, is there any role in vulval pruritus without any other
Yes.
lesion? Only vulval pruritus.
Yes, only vulval pruritus, because we see that if she is not responding to anyone, any treatment, any steroid, any oral tablets, yes, one thing I always prefer that I take a biopsy from the vulva, and that biopsy to be taken. If it comes everything is normal, yes, the laser helps in that. Because in my earlier career in SMS Medical College, one of my professors, she was very much in oncology, and when I was in her unit, they used to done a simple vulvectomy for the patient, those who have in non-responding pruritus. So this is very helpful in that. Simple the laser. This laser have one port of that probe is that is called the scanner probe. So by that we can give the externally laser.
Yes, I think diode gives good results. I'm giving sessions to one patient, and she is comfortable with 2 sessions.
Ma'am, how do you take the vulval biopsy?
There is a skin biopsy forceps. That is the dermatologist they use. Just
Okay,
put a means. So I just put a local dialocate. Then this gives you depth of around 3 to 4 millimeter of the skin part, and the pathologists say we are comfortable with diagnosing any of the lesion there.
Okay.
And that diameter is around 5 millimeters. So a circular tissue is to be taken. And what I used to do that by this forceps, I just give a break over that and take out that biopsy, and just to cut with the scissors or with the knife. And then I use the lasers, the same laser that trace, because the laser have also the ability probe or cutting probe is also in this machine, just to coagulate. It heals within a 2-3 days. By that time you are getting a biopsy report, the patient comes, that wound heals, and then you can start with the laser, the external laser you can do.
Ma'am, from how many sides?
One
For
side.
vulvar?
Yes, that if generalized pruritus, no obvious lesion is there, definitely from the one side we take. And if the multiple lesion means in lichen, especially if lichen we see, if the patient not responded to so many treatments, then definitely first you take, if any doubtful, so you just rule out the malignancy and then can proceed. So this is the OPD procedure. Otherwise, in our medical college, used to the patient admit for the GA, then give and applying 2-3 sutures.
Yeah, well, I think we are done with the questions. Anybody else? Okay, so thank you. Thank you, Dr. Leela. Thank you, Dr. Leela. You're really indeed a great support. And once again, whenever there's a conference in Pune, again, you will be there. I'm sure you'll be there for our next conference also.
So I'm inviting you all for the U of Oxy, West Zone U of Oxy in Jaipur, 13-14 June. So you have to come. Renuka, Wes, and Madan. Madan, you have to also come.
Yes. Thank you, ma'am.
Thank you so much, ma'am.
Sure.
Thank you. Thank you, Dr. Leela. Thank you for being with us, and best wishes to your all your achievements and your campaigning.
Thank you very much for giving this opportunity. Really, I very rarely see that 163 the participants I can see.
Yes. और वो सब मैडम खुद के पैसे भर के आए हैं. अच्छा. के पैसे भर के नहीं आया है कोई. अच्छा. And I take pride in saying that because our 16 coordinators are there. About 10 are from Maharashtra, about 6 are from outside Maharashtra. They have taken great efforts. उन्होंने ये सब डिसाइड किए स्पीकर वीकर मुझे जस्ट पूछा ये चलेगा ना चलेगा ना चलेगा ना. मैंने किसी को भी ना नहीं बोला है. So it is their efforts and it is because of faculty like you that so many members have registered, not only from Maharashtra, madam, but about 50 people are outside Maharashtra.
Great.
163 में से. So that's also a good thing for Amox also. As a Amox, it's a creditable thing.
Yes, the Amox college you all have started, no?
Yes. So we have started the Maharashtra College of Obstetricians and Gynecologists. We will be circulating. जो जैसा ICUG का वैसा ही वो कॉलेज है.
हाँ तो अच्छा है ना.
उसका एक इंटेंशन है कि एमॉस को थोड़ा बहुत हेल्प करे, एकेडमिक विंग कवर हो. अगेन मैडम वी हैव आल्सो स्टार्टेड अ न्यू थिंग which has not been started in any state organization, which is the Amox Teachers Association.
Great.
सिर्फ पीजी टीचर्स रहेंगे.
पीजी टीचर्स.
सिर्फ पीजी टीचर्स रहेंगे. बाकी कोई नहीं रहेगा. And gradually, I wish that the R.D. Pandit CME, which we hold in the Amox conference, that should be conducted only by the PG teachers. Nobody else will be involved in that CME. So let them, उनको भी empower करो. उनको भी, अब they are already are empowered, but उनको organization में लाके और empower करो.
हाँ, वो चीज है क्योंकि they are not getting time and they are not coming. ये थोड़ा सा उन लोगों का शिकायत होता है यार कुछ तो इम्पोर्टेंस दो हमें. मैंने कहा you come forward, everyone will give you support. अच्छा सर, एक अभी इस युवा फॉक्सी में we are strictly following 50% for the युवा faculties. और अभी हम ICOG में भी मैंने डॉक्टर पराग से बात हुई, मैंने कहा the speakers will be युवा and chairpersons will be all elders. So any of your this युवा from your city, you just encourage them to join that. We'll give them this all platform.
मैडम ये बहुत सही किया है आपने. क्या है अगेन व्हाट वी आर डूइंग इज कि होती है कॉन्फ्रेंस युवा की पर वही सब लोग सीनियर लोग ही आते हैं. होती तो है युवा की.
2018 में से वो करा था मैंने वहां पे जब उदयपुर में दैट टाइम आई वाज वाइस प्रेसिडेंट. सो उदयपुर में आई डिड द युवा वाइस प्रेसिडेंट फॉक्सी वो नहीं करा. मैंने कहा युवा ही करना है. उसमें भी हमने बिल्कुल स्ट्रिक्टली फॉलो किया एंड सेम वे इन दैट टाइम ICOG आल्सो कि वो सब यंगस्टर्स को बिठाया. हमने कहा तुम लोग सब करो.
सही बात.
So this time again the Parag is agreed for that.
Good.
The definition of युवा
less than 40 years.
40 के नीचे ना.
40 के नीचे है बहुत सारे बच्चे. एंड अभी हमने एक स्लॉट और बना दिया 10% टू द 40 से 45 क्योंकि जो 41 हो गया ना वो कहता अरे मैं तो युवा ही होना था. मैंने कहा ठीक है 10% तुमको देंगे 40% हम बुढ़े लोगों को देंगे.
वो तन से युवा होने चाहिए, मन से तो हर एक 16 साल का ही है अभी भी.
इसीलिए पूछा सर.
So definition is by chronological age.
सही बात है. चलो मैडम, it was a fantastic interaction. Thank you so much.
Thank you.
उसके साथ जुड़ जाने में thank you. और again best wishes to you And definitely we look forward to being at UA at the conference. Thank you so much. Thank you.
Thank you. Good
Thank you,
night.
Madam. Yeah, Renuka, our next speaker. Will you like to?
Yeah, I'll introduce our next speaker, Dr. Rahul Yande sir. He is the director at Shri Krupalu Hospital, Beed. He is the director at Reviva Cosmetic Gynecology and Aesthetics, pioneer in cosmetic gynecology in rural India. He has achieved his diploma in advanced endoscopy, diploma in cosmetic gynecology, diploma in cosmetic gynecology from Indore also. He has his own training centers and he is trained in threads, fillers, and Botox. He is recognized as a pioneer of cosmetic gynecology in rural India. I welcome you, sir. Rahul Yande, sir.
Yes. Yes.
Yeah, and one of the greatest thing of Rahul sir is that he himself has a training center, but he has made his wife join this particular course. So I don't know what exactly the reason is, but thank you, Rahul sir. I mean, thank you for being with us. And as a matter of fact, he does. I have met 2 or 3 students of him, and all of them are really impressed by the way in which he is conducting all these sessions. And when I met him in Pune recently, at that time he said that okay, fine, really, it's a good program that you have started, and there is nothing much that is to be done.
अरे यार प्ले कर
Play करा sir.
हाँ झालं का सर
जा रहे
अच्छा
चालतंय. So
Thank you so-
thank you, Rahul sir. And once your talk is done, again we will talk about the trainings that probably we can do.
Okay, sir. Thank you so much. Thank you, sir. Kurtukoti, sir. Thank you, Parul Sauji, madam. Thank you, Renuka Alsi, madam, for giving me this opportunity. This is first time I am doing this Zoom meeting, and so many learned scholars are listening to me. So I will start. Sir, everybody is blaming the tissue. Everybody is blaming there is a urethral mobility, there is a defect in the mid urethra, there is an intrinsic sphincter deficiency, but all are missing one very important thing which is very silent, that is they are missing the reflex. They play a very important role in stress urinary incontinence. That is the natural intelligence of the body they are missing. का जात नाही का होत नाही सर देवर्ष देवर्ष हे पुढे जात नाही yes so greetings from Bid. This is a Kankaleshwar temple of Bid. It is 2000-year-old temple. It is a golden temple of its age. It was covered with 51 ton of gold. Oh. And this was looted. But the temple is still standing. It is said that when you are stuck in your life, either in relationship or either in education or either in money matters, you visit this temple and you will find the way out. So do visit this temple. So this is my patient profile. They are sugar cutting workers. These are migratory population with very hard working condition. They migrate from other districts of Maharashtra, Karnataka, Andhra Pradesh, Telangana, and they come back for 6 months in Bid. So you might be thinking, I am talking about these women on cosmetic gynecology. What I am doing with these women in cosmetic gynecology? Yes, they do suffer stress urinary incontinence. They have vaginal laxity. They have intimate problems, and they also need the care that any urban woman needs. So I will break the myths in cosmetic gynecology. Whether it is only for affluent class, no, it is for all classes. Whether it is costly, at present it is a costly because you are going after very costly machines and you cannot afford the treatment to the patient at lower cost. It is only about the beautification of intimate parts? No, it treats the function. It treats stress urinary incontinence. It treats recurrent urinary tract infection. It treats recurrent vaginitis and post-childbirth trauma. Whether it is an unsafe procedure? No, it is a very safe procedure. Because what they are talking about, laser complication, hardly there is a complication. It's just hitting only 3 millimeter inside the vaginal mucosa. And that temperature is only 45 to 55 degree. It is for young women? No. It is very effective in post-menopausal women, particularly in cases of genitourinary syndrome of menopause. It is only for celebrities? No, it is for all women. Not necessary for human health. Yes, it is improving the quality of life in all women. So you might be noticing that some of you might not yet figured out what is a cosmetic gynecology. Same was the condition with me when I started. Since 6 months, I could not figure out what is it. So I have, after exposing for cosmetic gynecology for 1 year, I have made my own definition of cosmetic gynecology. The cosmetic gynecology is a specialized branch of gynecology that integrates techniques of cosmetic dermatology, plastic surgery, regenerative medicine to enhance both the functional and aesthetic aspect of female pelvic health. So to support my definition, I will tell you that we have borrowed lasers, fillers, thread, Botox from cosmetic dermatology. We have reclaimed our labioplasty, hymenoplasty, clitoral hood reduction, and we have taken the fat fillers from the plastic surgery, and we are using now biologics. We call it as a gynobiologics, that is a PRP, PRF, exosomes, and stem cells from regenerative medicine. So we will go in the traditional definition of stress urinary incontinence. SUI is involuntary leakage of urine during activities that increase intra-abdominal pressure, such as coughing, sneezing, laughing, or physical exertion due to insufficient urethral sphincter function and or pelvic support. This is a halfway definition. Now the cosmetic gynecologist definition of stress urinary incontinence. Stress urinary incontinence is involuntary leakage of urine during increased intra-abdominal pressure, not merely due to anatomical defect, but often due to dysfunction or delay in pelvic neuromuscular reflex arc that governs urethral closure. So we will go to the symptom-based grading of stress urinary incontinence. So this is a patient. Leaking occurs in a severe exertion, coughing, sneezing, and jumping. Grade 2, leaking occurs with moderate exertion, example, walking, standing, and lifting the weight. This is very interesting case. This is grade 3, leakage occurs at rest with normal minimal exertion, example, changing position or with mild movement. This was a case. She was a 47-year-old female and she had urinary leaks since 15 years. See, the mucosa is red. See, there are white patches there because long exposure. She was staining of ammonia. She has to take pads. She was not ready to sit on my sofa set because of fear of staining the sofa. And this was her condition. So I thought she is a case of stress, VVF, and I examined her thoroughly. She had been already investigated. She did not had stress. She did not had a VVF. So how can I help this patient? If I try laser, I may damage her more. If I try threads, the mucosa is not recipient. It is red and inflamed, infected. So what I have advised, please come and sit in the high fame chair. She was not also having money. So I said, pay me 200 rupees for one sitting, and I have advised her to sit every 4th day. She regularly came and sit on the chair. After 8 sittings, she said, I have got 50% relief. And after 12 sessions, she has said, I have got 80% relief. So I was not believing. I examined her again. She has got relief. Mucosa is changing. Now she was saying, I have got occasional leakage on coughing. So I thought she is the patient of severe dysfunction, internal sphincter deficiency. And how can she be benefited only with high fem chair? Then I have searched in the web, and I have also attended the conference in Goa, an international conference of regenerative medicine. Then I come to know we are all we are missing is a guarding reflex. There is a loss, fuse was short, and we are fixing the floor. There was a defect in the fuse, and we are fixing the floor. So what this has done, what is the guarding reflex? So when bladder starts filling, there is a instruction from central nervous system that contract pelvic floor muscle, and it contracts, and it do not allow the urine to leak. But in this case, this reflex failed, and she was urinating even at rest with minimal mobility. So it struck down me. It is not, structure is not the only cause. It must be something else. And that they are saying it is the reflex that is the cause. Delay in reflex or sluggish reflex is cause of stress urinary incontinence along with the structural weakness. So clinical grading of by urogynecological perspective, type 1, minimal urethral mobility, mild sphincter insufficiency. Type 2, hypermobility of urethra due to weak pelvic support, commonly seen after vaginal delivery. Type 3, intrinsic sphincter deficiency with severe urethral dysfunction, where sphincter fails to close properly. Then comes grading of cosmetic gynecologist. Grade 1, mild stress urinary incontinence with good tissue quality, good collagen support, intact reflexes or mild delay, minor leak on pressure. And in this patient, high-fem PRP work gives excellent outcome. Grade 2, moderate SUI with collagen weakness, reflex are more sluggish, urethral hypermobility, weak collagen support, weakened pelvic floor, sluggish reflexes. PRP high-fem works here. Grade 3, severe SUI with sphincter deficiency, reflex absence, severe collagen loss, advanced laxity, intrinsic sphincter deficiency, absent and reverse reflexes. PRP to nerve zone PRP and high-fem with threads can help such patients. So we will go to basics again. This is the anatomy of urethra. There are two sphincters, internal sphincter and external sphincter. Internal sphincter is by a smooth muscle located at the neck of the bladder. It works automatically. You don't have control on it. Remember this, we don't have control on internal sphincter. Brain does that control through the nervous system. The sympathetic nerves keeps it closed, and parasympathetic nerves helps it open. You cannot tighten or relax by your choice. It reacts on its own like a reflux. Stress urinary incontinence, the issue is often weak or delayed reflex, not weak muscles. Training these reflexes is a key to improve continence more than just building the strength. Then the external sphincter. These are the muscle you can control by yourself. It's operated by pudendal nerve. It wraps around the middle part of the urethra with compressor urethrae and uretrovaginal sphincter. When the system fails to tighten during coughing, sneezing, stress urinary incontinence can occur. The issue is not always due to weak muscle or damaged tissue. Sometimes the problem is in nerve signals. The brain sends the message, but the muscle does not respond. Then we will go to the supports of the urethra. This is important because when you are injecting threads, giving PRP, you should know where you are giving. This anteriorly, urethra is supported by pubourethral ligaments like a sling, like a hammock, and posteriorly, urethra is supported by anterior vaginal wall. When the support weakens due to childbirth, aging, collagen loss, the urethra becomes hypermobile, contributing to stress urinary incontinence. Traditional surgeries, sling aim to replace this lost support. But what if you could regenerate the support instead of replacing it? PRP and PDO threads are now doing their job in this particular situation. The approach respects natural anatomy and offers a minimal invasive solution in early stage of stress urinary incontinence and avoiding the surgery. Regenerating the ligament may restore continence without cutting, suturing, or foreign mesh. Then this is the endopelvic fascia. Now we are going deeper. It's a structural groove that links anterior vaginal wall with the pelvic side walls. When this fascia loses collagen or tensile strength, the urethra becomes unstable and continence fails even if muscle is intact. Threads, PRP are here. They are like sending collagen, blood memory into the forgetting scaffolding. Then these are other supports. The anterior support of vagina, superior support of cardinal ligament, uterosacral ligament. These ligament, fascia, pelvic diaphragm, levator ana, and perineal body. We weaken. If one weakens, the symphony flatters. We regenerate one, and the whole system may start to recover. This is where your treatment must become holistic and targeted. You are not treating urethra, you are tuning the pelvic network. So this is a very important test. Put a cotton swab inside the urethra and ask the patient to do Valsalva. This is Q-tip test. And when the mobility is, the angle is more than 30, you called it as a urethral mobility. Beyond the Q-tip test, look at the reflux. Measuring the urethral angle is helpful, but it is the only part of the story. Yes, the urethra moves, but ask yourself, why did not the pelvic floor muscle stop that movement? Why did not the compressor urethra or the supporting muscle automatically contract? This is not just a mobility. It's about the reflex arc that not firing properly. Conclusion, Q-tip test gives good clue, but don't stop at measuring angle. Ask deeper. If the reflex arc is working, is the signal reaching to the muscle? Because the real problem might not be what you see, but what is not responding. Then Boney's test comes. Put 2 fingers in the vagina and then ask the patient to cough. If urine stops coming, what is the conclusion of this test? If urine stops coming, that means you have done the surgery. If you keep something below urethra, the continence will go away. It means that bladder and sphincter still remember how to work. They just need a little support to do their job. There are no torn muscle or damaged nerve, just a missing signal. If 2 fingers can stop the leak, ask yourself, do we always need surgery first? Maybe we don't need the force to control. We just need to reawaken the body's reflexes. Give the right support and the body often does the rest. But what if she still leak after keeping 2 fingers. If she leaks even when the support the neck, then the issue is just not the weak support. The problem is in the reflex not working. What is really happening? Your 2 finger hold the urethra steady, but the sphincter does not close. The pelvic floor does not contract. The brain does not send message. This is not a mechanical problem. It is a reflex failure. As a clinician, what does that mean to you? You can place sling, thread, mesh, but if the nerve signals are not working, she may still leak. The reflex arc, the body's wiring is not responding. In regenerative medicine, this issue can be tackled with hyphen to wake up the pelvic floor muscle. She needs PRP to heal reactivate the pudendal nerve. What she needs is a reflex memory, not the mesh. Additional test you can do urodynamic study. How they are effective, I don't know. Then this low Valsalva leak point pressure less than 60 centimeter of confirm the intrinsic sphincter deficiency. Then Q-tip test we already talked. Then large more than 10 gram in 1 hour pad weight increase. And then cysto urothroscopy shows bladder neck at risk scarring fibrosis can be seen. Then we will see the reflex. This is basic. We are again going into basic. What is it? When the bladder is filling, your body sends signal through the nerve to tighten the muscle around the urethra. This helps stop urine from leaking. How does it help? It keeps you dry during coughing, sneezing, or sudden movement by tightening the muscle at the right moment. What happens in SUI? If this guarding reflex is weak or delayed, the muscle don't tighten in time. That causes urine to leak even if everything else looks normal. How can you look? During PV examination, we ask the patient to cough. If perineum is lifted, the reflex is working. And if there is no perineal lift, the reflex may not be working properly. Then perineal detrusor reflex. This is a press button. What is it? When you touch or press the area in the perineum, your body sends a message to the bladder to relax. This helps the feeling of needing to pee. It works like a natural pause button for the bladder when you suddenly feel urge to go. If it is not working well, the bladder keeps squeezing even when the brain says wait. So woman feels a strong sudden urge to leak even with liter urine in bladder. How do you know it is working? Some says if you press thigh together, the urgency goes away. Doni पाय असं दाबून धरले, the urgency goes away. That's the reflex in action. Device like hyphem chair helps to retain the reflex, especially in urge and mixed urinary incontinence. Then fourth, perineourethral reflex, quick closure to stop leaks. What is it? When you cough, sneeze, jump, or suddenly move, your body sends a fast signal to tighten the urethra so you don't leak. Why it is important? This reflex act as a first guard. It quickly closes the urethra before pressure build up in the bladder. If it's weak or slow, urine can leak out before your body can respond. How can you tell if it is a weak? If woman leaks with small movement or just by changing position, this reflex might not be working well. Then this is a cough reflex arc, body's leak blocker. What is it? When you cough, sneeze, or laugh, intra-abdominal pressure rises quickly. Your body instantly sends the signal to tighten the pelvic floor muscle that holds the urine. It happens without your thinking about it. If the reflex is slow or weak, pressure hits bladder before the muscle can close, leading to urinary leak. This is common in early grade 1 and grade 2 SUVI. If leaking starts just before and exactly as woman cough, this reflex might be delayed. How can we fix high fem chair high fem chair is the key to solve this problem. Threads and PRP also strengthen this. You don't leak because you cough. You leak because your urethra did not close in time. Voluntary cortical reflex, pelvic reflex, brain to pelvic floor connection. So the pelvic brain is independent. It is autonomic with having interface with the central nervous system. This is the only bladder control reflex you can control. When you choose to tighten, like in Kegel's exercise, we choose to contract the pelvic floor muscle. So the signal goes from brain to spinal cord to pudendal nerve and the muscle gets contracted. It trains and boosts other reflexes like guarding and cuffing reflex. Doing Kegel or hyphen is like taking your pelvis to the gym. If women who sits a lot have had a baby and postmenopausal, the brain to muscle pathway gets weak. If this signal is weak, the pelvic floor won't respond and leak happens. How can you build it? Kegel's exercise and HIFM chair. Whether HIFM will replace Kegels? No. Kegels are working locally, but it is when you HIFM is working locally, but when you do Kegels, it is maintaining the connection with the central nervous system. If brain forgets the pelvic floor forgets to respond. So see, in this patient, tissue is there, but it is not stopping the reflex. Reflex is slightly delayed, and she has immediately after coughing, she gets again continence. Reflex is slightly delayed here. So what is the regenerative approach? HIFM, only HIFM can do. Yes, in some patient HIFM can do. Then you can SUI PRP, you can fix this problem with PRP. Then you can fix with problem with only laser. That's it, laser quanticare. Laser quanticare plus SUI PRP fix with HIFM. Combination therapy works excellent. Quanti thread fix, you can fix with this threads, PDO threads. SUI PRP fix, HIFM, and mesh quanti fix. You can put Sarogi's mesh just below the urethra, and sometimes it works very well. So how to do PRP preparation? Practical. We need 3 tubes, 15 ml, sterile, 5 ml anticoagulant, ACD, acid citrate dextrose, PRP transfer pipette, 1 pair. So what we have to do? We draw blood. We drop 13.5 ml of blood. So it will make 15 ml with 1.5 ml ACD, antistatic dextrose. First you do soft spin, that is 1500 RPM for 15 minutes. So you will get this, 50% will come supernatant and the RBC will go down. This is after first spin. It is not clear, very clear, but it is a slightly turbid. Supernatant is slightly turbid. Platelets are there inside. Now you transfer this. You transfer this to a plain tube without anticoagulant. And then centrifuge. 3000 for 500 RPM for 15 minutes. With the pipette. Now, after that, you will get this. What? This is a platelet pellet you get. Then upper is platelet poor plasma and lower is platelet-rich plasma. That is what we need. Now transfer the platelet-poor plasma in another sterile tube, and around 3 to 4 ml you mix well, and the preparation is ready for injection. So combination. First, there are two schools of thought. What we do is a combination in one sitting. High fem chair. Patients first sit in the high fem chair. Then we do diode laser. Our dose of diode is a 6 watt 75 joule already programmed in that machine. Then we give cooling time 15 minutes, and then we inject PRP. This is our sequence. Hypem activates reflux arc and improves pelvic blood flow. Diode stimulates collagen and tighten the fascia. And PRP deliver growth factor where tissue memory has faded. It Then we give injection of PRP. First, we have to apply Prelox cream 15 minutes prior. Prelox cream, that is a numbing cream. And what you have to do, you have to give PRP in suburethral, paraurethral, and in uretrovaginal space. त्रास झाला तर सांगा. थोडीशी थंडी वाजून येऊ शकते एक तासाभरात. Load it into the insulin syringe by removing the plunger. That is important technique you have to learn in practicals. We can repeat this procedure every month for 2 to 3 sessions, or you can give gap between 2 sessions. One session PRP and another session don't do PRP, and next session you can do PRP. It depends on how the patient responds. Avoid giving anti-inflammatory drugs, but you can give tablet dolo, SOS. Don't treat SUI like plumbing issue. Treat it like disrupted regenerative system. This protocol does not patch the leak, it restores the command system. So what are the benefits of combining laser and PRP? Enhance absorption, because already the laser is causing micro abrasion. That is, there are micro holes are created because of laser, and the tissue becomes receptive for PRP. The collagen stimulation synergy. Diode laser starts remolding, and PRP fuels the builder, fibroblast, growth factor. One initiates, the other amplifies. एक initiate करता है, दूसरा amplify करता है. Together they don't just remodel, they regenerate. Reduce downtime. Laser may cause mild inflammation. PRP calms down and speeds the healing. Patient recover faster, cleaner and better. This is not just dual therapy, it's dual rescue. Improved result when you use both, you are tightening it's stronger, and SUI relief lasts longer. Post PRP, laser PRP instruction: avoid sexual intercourse for 4 to 7 days, no strenuous work for 48 hours, no hot bath or saunas, maintain proper hygiene, mild spotting or discharge is a normal, no harsh medication, avoid ibuprofen. They may interfere with the effectiveness of PRP. Stay hydrated, eat well, drink plenty of water, maintain nutrient-rich diet for tissue healing. monitor unusual symptoms, SOS reports. There is a hardly, yes, there are two complications. I noticed some patient, one patient is having severe headache after giving PRP. The cause I don't know. And the two patient is having shivering. The follow-up appointment, attend and revisit after 4 to 6 weeks to assess the progress. So what is the timeline? You expect that it will heal 0 to 24 hours, mild warm, swelling, initial hydration. For first to 2 weeks, improved lubrication, subtle tightening, early SUI relief. थोड़ा ठीक लग रहा है. 3 to 6 weeks, noticeable collagen synthesis, better vaginal tone, improved SUI. 3 to 6 months, peak tightening, hydration, maximum SUI improvement. 6 to 12 months, long-lasting result and maintenance phase. We have to maintain it. After, ask the patient to come take this treatment after 6 months again. So what is the mechanism of action of PRP in SUI? Tissue regeneration. There are so many growth factors are delivered in the system, that is the platelet derived growth factor, transforming growth factor beta, then epidermal growth factor, vasculoendothelial growth factor. It strengthens the urethral mucosa and paraurethral tissue, neovascular angiogenesis and improved vascularization, neuromodulation and nerve regeneration because of growth factor, NGF, and anti-inflammatory and healing properties. It produces anti-inflammatory cytokine and reduce pro-inflammatory cytokines. So when you are injecting PRP, you are sending a crew to fix the problem. So every growth factor will do their different problem. Like if you want to fix your home, somebody is doing plumbing, somebody is flooring, somebody is light fitting. Similarly, it fixes the problem. Different growth factors fixes different issues. Then quantity thread fix. We can fix moderate to severe type of stress urinary incontinence by using PDO threads. So this is a video of PDO threads. The common cause is urethral hypermobility. To fix the urethral hypermobility, you put the threads in the paraurethral space. 2 to 4 threads are put, then suburethral threads, and we put threads in uretrovaginal space. See, do catheterization so you will get some grip. First, Prilox was given 15 minutes prior to this procedure. If patient is anxious, give injection 4 30 milligram, 50 milligram, atropine 0.6 milligram, 40 minutes prior to your thread procedure. Inject using insulin syringe. Inject therapy using insulin syringe. So here we are using 38 mm and 29 G threads, PDO threads. That is the screw threads we are using. That delivers good volume. This is the paraurethral area. Put the thread. 2 thread we are delivering in this particular. It gives structural support. Dr. Vidya Bhatt madam came specially for thread, learning thread to us. Now we inject the thread, we create a mesh just below the urethra by using PDO thread. This is a video. Like we put Dr. Sarogi's mesh, we put this thread just below the urethra. 5 to 10 times, 10 threads are kept just below the urethra. You can increase in next sitting. These are preloaded threads. Once that ring, ciliatic rings goes away, then the thread is delivered inside the targeted site. They give immediate tightening effect. Similarly, we put thread on the other side. Then we put the two threads each side in uretrovaginal space. In same sitting, we give PRP. Again, in paraurethral, suburethral, and in uretrovaginal space. About 4 ml of PRP is given. So this is our training sessions. Dr. Mahale sir, my postgraduate teacher, also came along with his daughter for the training. So this is a large study of 236 cases from America. If you put the threads in suburethral, paraurethral, and uretrovaginal space along with the PRP injection, it forms a fibrotic mesh-like network just below the urethra and increase urethral resistance and prevent stress urinary incontinence. So PRP, you can give suburethral, uretrovaginal space, paraurethral. Then sometimes you have to give PRP in ischiorectal fossa to nourish the pudendal nerve at its exist. Then to fix the clitoral then you can give near the clitoris. Then perineal body, posterior vaginal wall, you can give deep into to fix the nerves that is entering into the perineum. This is the axial view, and we can form different patterns of thread. That is a V pattern at urethra like this, and then H pattern similar to what we have done now. Then we can form a half fan like pattern, then mesh like pattern. As a mesh you can form there. So mechanism of action of threads: mechanical support to it gives instant mechanical support, and it stimulates the collagen and fibrosis formation, induces fibroblast activation, and enhance urethral support via type 1 and type 2 collagen, new vascularization and tissue regeneration, improved blood flow, tissue elasticity, mucosal integrity for better urethral closure, neuromodulation, pelvic floor tone enhancement, stimulates nerve ending, improves sphincter function and voluntary control, prevention of urethral hypermobility, stabilizes urethra, reducing excess downward movement, long-term bioabsorption and tissue integration. Threads, these threads are biodegradable, last for 6 to 9 months, leaving behind fibrotic scaffolding, maintaining support for 24 months. So these are different. There are 28 types of collagen. Our importance: type 1, type 2, type 3, type 4, and type 5. PDO stimulates type 1 and type 3 collagen, improving vaginal tone and urethral support. PRP therapy enhances type 3 and type 4, promoting tissue repair and rejuvenation. Laser and RF treatment boosts type 1 and type 3, improving elasticity and firmness. So what is the mechanism of HIFM chair? We always combine HIFM chair in all cases. SUI is not muscle weakness. It's a neurological signaling dysfunction. Reflexes like guarding, curve, perineourethral may become underactive or asleep. Disrupted brain to muscle communication. Patient often lose voluntary pelvic control, not due to laziness, but because broken brain muscle reflex arc. HIFM bypass the cortical apathy, directly stimulates motor neurons, activating pelvic floor muscle involuntarily without conscious effort. They cause a supramaximal contraction, means the intensity and duration of contraction you cannot achieve by your voluntary effort. One session can induce 11,000 supramaximum contraction, promoting neuroplasticity, and the brain start to recognize these reflexes again. Reflex reactivation, repeated session enhances guarding reflex, improve cuff reflex timing, and restore voluntary cortical loop connectivity. Continence improvement. Improvement is not just due to muscle strengthening, but also due to reactivation and retraining of neural circuits. Summary: hyphen is not just a chair, it's a neuromuscular conversation restarter between the dormant pelvic floor and active brain. So what are these? Are different muscle targeted: levator muscle group, coccygeus muscle group, external urethral sphincter, perineal muscle, endopelvic fascia, pudendal nerve pathway, pelvic diaphragm, deep transfer perineal muscle, sacral plexus. So it is useful in vaginal laxity, pelvic organ support, pelvic floor relaxation. Then in cases of pain, stress urinary incontinence, perineal laxity, prolapse, improved neuromuscular control helps in sexual function, general pelvic weakness. So it enhances overall bladder control and sexual response. So in stress urinary incontinence, along with the treatment, we have to look at the nutrition, because we are getting 3 to 4 months time to fix our nutritional deficiency. So along with, you can give magnesium citrate tablet. It supports the neuromuscular relaxation, reduce pelvic floor tension. Advise the foods: spinach, almonds, pumpkin seeds, banana, dark chocolate. L-arginine 1000 milligram per day improves vascular supply and tissue healing. Rich dietary sources: nuts, seeds, like zinc 15 to 30 milligram per day, support urethral healing, immune response. Rich dietary sources. And collagen peptide, you should always, along with the thread procedure, you always prescribe collagen, marine collagen to the patient. They do very well. And high protein diet, rich dietary source. Then vitamin C 500 to 1000 milligram per day, enhance collagen production, aids tissue repair, rich dietary sources. And then omega-3 fatty acids to be prescribed, and vitamin D weekly for four times. Then maintain hydration, protein intake should be adequate. Avoid processed sugar, caffeine, pelvic floor exercise, combine proper nutrition like Kegel along with the Kegel. HIFM is not replacement to the Kegel exercise. You should always advise the patient to do Kegels. Then what the research shows, different studies are conducted. These are randomized control trial. 60% shows moderate to excellent improvement, and 20% achieve complete dryness. This is again a randomized control trial. Between 2019 and 2014, there are 7 studies, RCT, randomized control trial were conducted. PRP injected in periurethral, midurethral, 1 to 3 session spaced 1 month apart, compared with PRP with pelvic floor muscle training, placebo, and midurethral sling. Outcome and the symptoms improvement, significant reduction in leakage, and improvement in score. Continence rate 46 achieved dryness in some studies. PRP outperformed placebo. Safety, no serious adverse effect, minor transient voiding issues in rare cases. Conclusion, PRP shows promise for SUI management with positive outcome and good safety profile. However, evidence is still emerging. Large, high quantity trials are needed to confirm long-term efficacy and refine protocols. So, takeaway message: SUI is not just an anatomical defect, it is a dysfunction of reflex arc, neuromuscular memory, and pelvic brain communication. PRP is not merely collagen, it is a regenerative spark that can rewire dormant reflex loops, repair nerve ending, and revive pelvic intelligence. Combination therapies, hyphen PRP threads, energy-based device don't just strengthen, they reconnect the system, structure, signals, and sensation. Clinical success is not from tight tissue alone. It comes from timely contraction, reflex activation, and restoration of pelvic harmony. Gyne biologics is not the trend, it is transition from fixing what's broken to awakening what is asleep. This is our happy trained students across the India. Dr. YK sir also came to our center. We don't treat leaks, we restore signals. We don't teach silence, we reawaken the reflexes. Thank you so much for your patient hearing. Thank you, sir.
Lovely, Rahul. क्या बात है?
Thank you.
Everyone is mesmerized. You know, trance मध्ये गेल्यासारखं वाटलं.
अरे, thank you, sir. First time
This is the most important slide. I think everyone should take a picture of this slide. हे हलवू नका साहेब. Everyone can take a picture. I will also share a picture of this thing on the group. You know.
Yes, Dr. Rahul, you have brought out the complete science of that.
Thank you, madam. Thank you so much.
So, I think no one can explain like that.
Yes, very nice talk, sir. Very nice talk.
Very, very.
How I understand as a layman. So this is like how I understand. I am just trying to explain.
It's all scientific basis. What you have connected that.
Yeah.
Really. It's a wonderful.
So, Renuka, can you ask 41 questions to Rahul?
Oh. Yes, sir.
Viva. I may fail in Viva.
No,
No.
You have topped in the practical. That is more important.
So, what are the complications or contraindications for thread?
Those who are sensitive, those having active infection, and yes, these are only, nothing else.
Okay.
All blood parameters should be normal. She should not be having blood dyscrasia, bleeding disorder, and all.
Yeah, can you stop sharing, Rahul, sir, so that we know we can see you?
Stop sharing. Yes. They were. हे बघ, stop sharing कर. Stop sharing होत नहीं. किधर है? Stop sharing कर. किधर है आपका?
Okay, there's a small question. Why is PRP looking red in the video?
Yes, sir. I am using PRP ACD solution, not the gel one. And again, what happens? There is a density gradient. First, the RBC settles down. Above that, WBC settles, and above that, platelet settles. So when I am transferring, I always take some RBC. I am having that in mind ki this I'm losing some platelets, so I always take RBC in it.
Okay.
So there is no
Yes,
problem.
yes.
Okay.
When I learned, he taught me like that. Ki
Okay.
if some RBC comes in, then your
Doesn't matter.
PRP is having 4x or 5x concentration.
Okay. 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 It is like, I mean, you use RBC like if at all there is a CSF leak during spinal anesthesia, what they do is they inject a small quantity of blood and they do a fibrin plug.
Ah,
So that is how the mechanism may be working. I don't know.
I don't know, but I'm having
Yeah.
that. Yeah, I always ask to keep some RBC at the bottom, so my PRP is a 5x.
अच्छा म्हणजे जेवायच्या अगोदर जे आपण बाजूला शिंपडतो थोडस आपलं थोडस
हा,
आरबीसी
तसं.
असूच
तसं असतं. Not if you use gel tape, no RBC will come
Yes,
because
yes.
it is what gets separated.
ओके
Rahul sir, Rahul sir, one thing is that always there is a discussion if we are putting PRP when there is a heat is there.
Huh.
And there is a
So, madam, we are giving enough cooling time after energy-based device. 15 minutes time is enough.
After 15 minutes.
After 15 minutes.
Actually, inner tissue is heated up. It never
No,
gets
tissue,
cooled up.
madam, that tissue is only heated 45 to 55. It is nothing. Immediately, once you withdraw, it is a normal temperature.
Yes, that becomes a normal. So, but there are few studies they say that there should be a gap. But you are doing and you are getting results, and it's
So
Yeah.
there are some studies which says ki if you give immediately, it is having more good result, more enhanced result. Because what PRP does is regeneration of the tissue and regeneration of the collagen, and this energy-based device is just remodeling of the collagen.
Yes. So the thread is you are using as a in place of that sling.
Yeah. We are just putting threads just below urethra. We are giving just a support because it just needs support, some support.
Yes.
Okay.
That is
So we will take the questions one by one, sir. Diode and CO2, which will be your choice?
No, I'm using diode. I don't know about CO2. CO2 is having very less depth. It only targets just mucosa. You say mucosa. So I don't believe in more of a laser and all kind of this.
Okay. Is activation of PRP required before use?
No, not needed actually. Well, some people use as calcium citrate for activation. I don't use.
Okay. How do you counsel patients in local language for SUI that injection needs to be given? Come on. That's okay. That's okay. How many ml of PRP is injected, sir?
3 to 5 ml of PRP is injected.
Okay. Renuka, can you ask? Or
Yeah. Is there any infection after treatment with threads?
No infection, but there is a chance of thread extrusion. There is granuloma formation. Chance are there, but I have not because threads are very small threads, but the strength is bigger.
Okay.
But I have not experienced any thread.
Do you
People
give
are
this
using
shot?
on face.
Okay.
We are using the same thread in vagina. We are yet to manufacture threads for intimate parts and SUI.
Okay. Do you
I
give
feel we
short
need
G
more
yourself?
advanced. Huh?
Yeah. Do you give short G yourself?
No, short G is not required, madam. Short G is not required. Only give local Prelox cream to be applied inside the vagina 15 minutes prior. But you have
So
to
even
apply
for threads?
good quantity. Huh? Yes,
Even
for threads. And for catheterization, local xylocaine jelly you put.
Yeah, that's okay. What is the cost of thread? Each thread, or is it?
See, cost is cost. What I get is a thread for 2,000 because I buy in quantity. I buy 50 threads. So if you buy one thread, you will get at 3,500 rupees. That you will get 20 threads.
So one thread is how much cost?
20 thread, 3,500 for you. If you buy in bulk, like 50 or more than 25, then you will get 2,000 rupees. 1,000, but you can use 2,000 rupees in 2 patients. You can inject this thread for vaginal tightening also. No need of doing repeated laser. It gives best results.
Okay, which is the company of the thread?
There are so many companies. I don't know. I will show you. This is what I use. This thread is what I
No.
use.
Can you tell us the name, because they would like to.
Remedy Lift. Remedy Lift. It is Korean thread.
Sir, can you please share the name of the company and the vendors for the thread?
Yeah. I will share.
Yeah.
Okay. Is PRP made in your own lab? Yes. If we have.
Yes. You have to prepare your own PRP. You should not outsource the PRP. This is very simple to do. Just you have to see once, and you will not forget any time. And do yourself for 10 times, and then teach your colleagues.
A simple way that you can learn PRP is you can go to the nearest blood bank. Many of our gynecologists went to Jan Kalyan blood bank just to learn PRP. Of course, that was 7-8 years back. Now, everyone does it on their own. So anyway, what are these threads made up of?
PDO, polydioxazone thread. They are absorbable material. There are other types of threads also. PLLA threads are also there. Polypropylene threads are also there. But for gynec use, we are using this PDO thread because they are available to us. And intimate threads are very costly threads.
Okay.
Not available in India. They are patented product. We have to manufacture our own threads.
Okay.
And we have to manufacture threads for stress urinary incontinence, vaginal laxity, clitoral hood reduction. Then threads can be given in G-spot augmentation also.
Anyway, if a thread goes into the bladder,
nothing will happen.
Okay.
Autolysis.
Okay. Complication or contraindication for thread?
Complication, I already told you, granuloma formation, exclusion of threads. If goes superficially, not in the correct plane, then patient may have pain.
So how to decide on number of threads?
Severity of the stress urinary incontinence, but I usually put around 14 to 15 threads in stress urinary incontinence, because 10 threads required 2 threads paraurethral, 10 threads suburethral, and 2 threads in urethrovaginal space.
Is there
any particular for the consent in threads?
We take consent. This is the new method of we are doing on this. These are some complications, and you may get result or you may not get result, but worth trying before operation.
Do you give antibiotics after this?
Yeah, we give antibiotics. Cefixime we give for 5 days.
Okay.
Do you admit each and every patient? I mean, do you take consent for admission for each and every patient?
Admission is not required. OPD based procedure, we give card to the patient. We give card to the patient.
Card to the patient.
Every time she has to bring card.
Okay.
And we take consent. We are having file of consent.
Okay. And what about the patient?
How many days is the result expected after thread?
After thread, the maximum result will come in 3 months. Okay. After injection of thread, gradually it will lift, and whatever result is after 3 months, it will stay.
Yeah. So it will stay for how long?
18 months, 12 to 18 months.
And then you repeat it.
SOS repeat, but by the time you can achieve the strengthening by pelvic floor muscle exercise, HIFPM and all.
Okay.
If reflex is established, SUI is gone.
Okay. Again, I would request you to share the name of the company, the vendor number, everything.
Yes, sir. मी आता ह्याच्या ग्रुपवर टाकू का आपल्या?
ठीक आहे.
सर नाही आहेत बहुतेक ग्रुपला. सर मला मेसेज करा. I will put it on the group.
मला टाका किंवा रेणुकाला टाका.
आता टाकू का लगेच काय?
लगेच टाका. लगेच
टाका.
कोलॅजन पेप्टाइड ड्रग नेम.
Vital.
Okay. Brand of marine collagen.
अरे हे जिम मध्ये घेतात नाही पोरं ते द्यायचं. काय जिम मध्ये खात नाहीत का कोलॅजिन हे लोक?
ओके.
ते आता असं आपल्याला भेटत नाही. मला कुठलं माहित नाही. तेच देत असतो मी. 2000ला येतं एक डब्बा.
हो, माहिती. ते मला माहिती.
आता दुसरं काय असते तेच.
ओके. How to decide the number of threads? तुम्ही म्हणलात ना काहीतरी 10. किती?
10, 14.
14.
14. Again, name of the company, cost of thread. Which company diode are you using, sir?
I am using photonics diode. Photonics. AR Photonics company.
Okay.
It is Thane-based company. They are having very good service. Whenever thread my breaks, they immediately give me.
Okay. Okay.
Fiber breaks, sometimes. Fiber, you need fiber breaks.
Okay.
But sir, they are very safe. The lasers are very safe. What they are talking about the fistula formation, it cannot form fistula. It is going only 3 millimeter. That is a diode. What it is only acting superficial. If you put hot water inside this HSG cannula, you condom, you fix the condom and put hot water inside. What it does is the same laser is doing. Why you are paying so much amount to that laser? It only here it will diffuse the temperature energy, diffuse energy. It is just heating the submucosa. Why you are spending 50 lakhs rupees for that laser? No one will buy from you second hand. Permanent loss.
Okay. Cost of photonic laser?
9.5 lakhs.
Okay.
But it is having multi-tasker. It also gives you the apna colorectal, fistula, fissure. Then if you want to upgrade for liposuction, if you want to prepare nano fat extraction, that later on you want to upgrade yourself for this liposuction and all, that is again you can use that machine even for cutting the septum.
Okay.
Septum. So this is a multitasker machine.
In the last 10 days, this is the first time somebody will feel that okay, we can do it. टप्प्यातले आपल्या आवाक्यातले.
सगळे करू शकतात. Easy to
35 lakhs, 40 lakhs, 50 lakhs.
Exactly, sir.
And see, the cost of HiFM is 2.5 lakhs.
त्या हायफेमचा वेंडर सांगा आणि तुम्ही एजन्सी घेऊन टाका.
सर अजून एक क्वेश्चन आहे की पहिले लेझरचे किती सेशन जायचे, पीआरपी द्यायचं, थ्रेड केल्यानंतर परत रिपीट लेझर करायचं?
लेझर नाही करायचं. थ्रेड टाकल्यावर लेझरची गरज नाही.
हा, म्हणजे मग त्याचं ऑर्डर कशी आहे, क्रोनॉलॉजी?
नाही, आम्ही पहिले हायफेम देतो. हायफेम देतो. थ्रेड टाकलं तर पीआरपी देतो.
नाही सर, त्याचं ऑर्डर कशी, म्हणजे हायफेम किती वेळेस द्यायचं, मग त्याच्यानंतर काय करायचं?
Our हायफेम प्रोटोकॉल इज twice in a week for 3 weeks and once in a week for 6 weeks. Total 12 session.
So can you repeat it? Hyphen protocol?
Twice in a week for 3 weeks and once in a week for 6 weeks.
आणि मग सर पीआरपी लेझर झालं, पीआरपी करायचं, देन आफ्टर इफ यू नीड.
सही मॅडम, इंग्लिश प्लीज.
I'm so sorry, sir. Actually, I got into the flow, so I just asked in Marathi. I'm so sorry, sir. Yeah. So the thing is, first we need to select the patient, and then again we have to do first HiFem. Then again we have to go for the laser. For every patient we have to do laser, or we can go directly with thread and
no. I don't do laser with when I am injecting PRP threads, I don't go for laser.
Okay, so the thing is
either or.
But HiFem is compulsory for every patient.
Yeah, HiFem is compulsory.
Okay, sir. Thank you. And sir, what about the post-void urine patient having post-void urine? There are so many patients who have post-void urine problems.
Yeah.
So what is the treatment for that?
HiFem is a treatment.
Okay, for post-void patients.
See, if there is a recurrent urinary tract infection, there is one study in Egypt. We are also following that protocol. recurrent urinary tract, we inject, infuse intravesical, we do intravesical installation of PRP. Very nice result. We have done 15 patients. One patient of honeymoon cystitis also, very good results. If nothing is working, it will work. So many patients comes to you now. There is a thickened bladder wall, changes of cystitis seen, patient often having urinary complaint every 3 months. They change the doctor changes the antibiotics. These patients get very good relief with intravesical installation of PRP. So what you have to do is take a 40 ml blood, collect a 5 to 6 ml PRP, we use infant feeding tube, and then slowly inject. Ask the patient to hold for 1 hour, change the position, supine position 10 minutes, left lateral 10 minutes, right lateral 10 minutes, and prone position 10 minutes. So it will be whole on, it will be applied whole inside the urothelium.
It will be coated rather than
and the film which is formed, the biofilm which is formed, it will take care of that, and gradually there is a rejuvenation of the urothelium. That
and
is
after how many hours she can evacuate the
bladder? 1 hour is our time. 1 hour is
1 hour is for
holding time. Our holding time.
Holding time is 1 hour.
Yes.
Hello, sir. I'm Dr. Saeed Eglurkar from Nanded.
Oh, thank you, madam. Hi, see you.
Sir, second year.
Yes.
You were there when I was in second year.
I was lecturer there, na?
Yes, sir. Yes, sir.
Yes. So this is my book. We have designed protocol. This is called PRP fixed protocol for all gynecological condition. So we have designed this protocol.
Doctor, where can we purchase?
आता हे अजून आम्ही ते काय publish वगैरे केलं नाही, पण if somebody wants the copy, we can send.
No, we will publish it. Amox.
Yeah. Oh, publish.
That's a great thing.
100,000% Amox will publish it.
Yes, sir. Thank you, sir.
100,000%.
Okay.
Done.
Okay. Thank you.
Done.
Thank you.
Done. And we will give it to all these people, all these bachas. I mean,
okay, sir. Yeah. We have another book called as G's, Unveiling the G-Spot.
Sir, in cosmetic, I think you are the unsung hero.
Sir, this is our book. This is Unveiling G-Spot, where we have covered everything in G-Spot augmentation. How to prepare PRP, how to give HA filler, how to inject threads. What is G-plasty? There is a surgery for G-plasty. We have covered everything in it. We have covered all energy sources, their action, and what are the drugs to be available for female. Everything is covered. Then we have got this GSM ka book. My wife, Beyond Menopause, a cosmetic gynecological perspective for genitourinary syndrome of menopause. Everything. And I am just writing this SUI leak fix, the playbook for cosmetic gynecologist. Leak fix. This is under, we are just writing. We will have, in next month, we will be completing this writing.
But where can we get this book? I mean, are you with JP or with Evangel?
No, sir. I am a poor man. Those who want, I am just giving them. If you want this book, phone pay me 1,000 rupees. I will send you.
No.
Sir, we want these books. Please let us know your address. We will pay.
Okay.
There is not a question of that. Of course, what we will do is we will work out a way by which it can be an Amox publication. So let it be a publication. It will give a different this thing, Dr. Rahul. I mean, you are working so hard and you have done so much work. So I think definitely we will do it. In case it is feasible, already you have designed everything.
Yes.
Already you have designed. Your person has already designed everything. Yes. So there is only thing is that in case you are willing.
Yes, sir. I'm just because nobody. I'm just this is opportunity for me now.
Yeah.
No, sir, but we want to buy these books right away.
Yes,
we can give it if Kiran sir is giving us all complimentary 160 books. We are happy.
That's what I am trying to find out.
Also.
That's what we are trying to find out in the ABCDI program for IVF. we have formulated these books. So, I mean, this is an Amox publication which will be given to all those people who have attended the ABCDI, that is IVF training program. In the same fashion, whatever Dr. Yande will give or whatever any of the speakers will give, we will compile it, no problem at all, and we will give it free of cost to all those people who are attending the program.
Yes, sir. Sure, sure.
That much is okay. That much we will do it, no problem at all. Not a big deal.
Sir, but please share the names of the books and the prices on the
Okay,
group.
okay.
हा ते कळलं ते तुम्ही शेअर करा डॉक्टर ग्रुप मध्ये किंवा मला टाका रेणुकाला
मी ग्रुपवर टाकून देतो.
टाकून द्या, काही प्रॉब्लेम नाही. And it is you can pay and do it and get it done anyway. Okay. When and how many days in a year training course is available? See now for every month.
Every month training. Next month is I have posted already. It is like 19th and 20th of February. Every month. We don't declare. We declare only next month date.
The fees.
Fees is a very less, madam. Low cost cosmetic.
Sir, we will work it out. We will work it out anyway. अरे तुम्ही त्यांच्या डोक्यावर बसू नका. I am going to talk with him. See what happens about everyone must understand, all 180 people, that getting patients is very difficult, and that is why these courses are very, very highly priced. Now, fortunately, Rahul sir has been kind enough when we spoke in Pune recently. So we will have some kind of tie-up with not only with you, with everyone. Na? So let us work out simple way by which all of us can go and attend. Even I want to go and attend. When Dilip told me, when Dr. Dilip Palke attended and told me that it's a good opportunity for you to go, immediately I phoned up Dr. Rahul. So that is done. That we will work out. What is the cost of HiFem?
So please share the vendor of this HiFem also and all your this thread, photonics, everything.
Okay, ठीक
आहे. Photonics आणि thread.
लगेच पाठवू का?
पाठवा की सर. ते काय त्याला
रेणुका मॅडमला पाठवू.
हा रेणुकाला पाठवा. So any other questions from the delegates?
Sir, what I could make out, sir said that he bought HiFem for 2.5 lakhs. That's why we just got, like, I got interested. How come?
See, madam, what they claim in HiFem is that they are having, you cannot use name HiFem, high intensity focused electromagnetic stimulation. They are focusing on urethra and vagina there only. But what we are getting in the market is an electromagnetic stimulator, what they are saying. But I am saying this, which is contracting the whole pelvis. But the other, this low cost machine is giving more benefit than the HiFem chair itself. I am Sela.
Okay. So what is the name of your HiFem? I mean, your chair?
Kigela.
So please do share the vendor's number, please, with Kiran sir, and he can pass on to us.
Yeah. I will give it to you. I think even Dr. Kumar has purchased this chair.
Thank you, sir. Thank you so much. Thank you.
Yeah. Any other questions?
Yes, sir. One question from my side.
Yeah, Reshma.
Yeah, good evening, sir. Good evening, Rahul sir. Reshma here, Dr. Reshma here. Sir, just one question from my end. Comedian thread, I mean, the thread which you are using right now is PDO monofilament or that cox thread?
PDO, for SUI, we are using the PDO screw thread.
Okay. It is a cork thread, sir? PDO
No, we are not using cork thread. We are using simple PDO thread, and they are like screw. So it delivers very good volume. Even though it is a 38 millimeter, but the volume is around 80 millimeter of thread is delivered. So the more amount you deliver, there is a more tropoplastic, more strength will be there. So we are using screw thread. What the Westerner, I met recently Dr. George Tito at Delhi, and I have shown my work. And what he is using, they are using screw thread, which is costing 40,000 rupees per thread.
Right.
The total cost of Aptos thread goes to around 180,000 rupees. So whatever we are achieving with these simple threads, because there is one study using same PDO threads in America that I have quoted already, that they were using the same thread which we are using, screw thread only. Literature
Sir,
shows.
one question. So till what level of laxity, like 2 finger, 3 finger, 4 finger, laxity of vagina, you use the threads till what? And then after that, where you advise them the surgical part?
See, if patient's complaint is vaginal laxity, some patient comes, मला मोसम कळत नाही असं कंप्लेंट घेऊन यायला लागले आता 3 वर्षानंतर पेशंट. त्या पेशंट they need surgery, and we have designed special surgery for them that is called as precision V intimoplasty. We don't call tightening because we don't do anything tightening there. Tightening is something like a strangulation. What we do is a surgical correction followed by thread injection followed by O shot, and even we inject PRP in lateral vaginal wall and at the site of operation. So this is precision V intimoplasty. We have patented this. We have applied for the trademark and we got the trademark also.
Okay. So one more question, sir. Do you do single thread vaginal tightening?
Vaginal? No.
Single thread vaginal tightening with these
that is called as a composite combined. That I don't do because that requires Aptos thread.
No, it actually requires Cox thread.
It has Aptos. There are 12 points created and you pass the thread to all points.
Yes, sir. Yes. Okay, sir. Thank you, sir. Thank you so much. That was really a wonderful and amazing lecture.
Thank you, madam. Thank you so much.
The practical tips that you have given are the genuine practical tips, which has really worked at the base.
Once you do, you then know what is there.
Yes, sir. Thank you, sir.
We are doing a lot of work now in cost. Now daily patients are there. Previously we are getting difficulty. Now so many patients we are getting. Patients are coming for complaints. To your question, that what level? Threads increases 1 level. If the patient is having grade 3, then it becomes grade 2. It will not become grade 1 or grade 0. Grade 2 will become grade 1. That's only it helps. Not grade 4 will not become. Grade 4 में तो डालने का ही नहीं thread. कुछ नहीं होता. थ्रेड में डालने का है, लेकिन इंटिमोप्लास्टी करने के बाद उसमें डालने का थ्रेड. Lateral wall. Because lateral wall will remains lax. So you will fixing posterior wall only. The lateral wall remain lax. So put thread in lateral wall. Along with that, give PRP. So you are taking care of G spot also, O shot also. G spot augmentation, paraurethral on clitoris, around the clitoris, and yeah.
Sir, what about the patients having first degree prolapse with SUS? Thread use, basically.
You can combine the vaginal thread lift. V-thread intimoplasty along with the thread. It will tighten. Some tightness will be there. Grade 1, grade 1 prolapse में कुछ नहीं करने का मैडम, हो जाता है वो. What we do is we inject PRP in cardinal ligament and uterosacral ligament and anterior fornix, posterior fornix and lateral vaginal wall and at the side of the cervix. That gives excellent result. It will prevent the further descent of the uterus. That is, people are trying. In our protocol, we have given that protocol also.
And what about thread use in that?
You can use threads, but you have to use cog thread. We are working on it. We don't get how to insert exactly how to go there. That is the problem, but we will crack that also.
Mesmerizing lecture, Dr. Rahul.
Thank you.
Absolutely wonderful lecture. We learned different gynecology today. Little. I just want to know how many cases of SUI you must have treated by now?
SUI? 25 cases, sir.
And did you come across any failure in such cases?
Yes, sir. 4 failures are there.
What could have been the reasons for failure?
Our incompetence. Initially, we don't have how to prepare PRP. Gradually, we learned. And patient sometimes don't follow up patients, and sometimes something is missing from our side or something is missing.
And did you have any exclusion criteria while selecting these cases?
Patient should have trust.
नाही नाही, याला नको करायला बाबा आपण ही केस, हे सर्जिकललाच जाऊ दे असं एक्सक्लुजन.
असं नाही, आम्ही पेशंट मोस्टली आवर पेशंट कम patient want non-surgical approach.
Okay,
so we say we don't charge much to the patient.
Okay.
So patient becomes ready for that cost, and so there is no problem. We say ki if this fails, my work is over, then you go to some urologist, somebody else who can fix your problem.
Okay.
Sir, how much do you charge for threads and PRP to a patient?
Shall I tell you that figure? Very less, madam. You will be surprised.
So it will encourage us to charge our patient,
especially for one session, I charge whatever what I feel ki my patient can afford sonography like charges. So if patient comes to me, I charge 1.5 thousand rupees for high-fem chair, plus if I am doing a laser, 1.5 thousand rupees for one sitting. If I am doing PRP, then I charge 3,000 rupees, and if I am doing threads, I charge 8 to 10,000 rupees. But anyway, it is negotiable, not hard.
Yes, sir. So any comments on wall prolapse, like apart from sacrocolpopexy, any comments any other way to treat wall prolapse?
I don't have, but I have because we treat so many vaginal infection. Whenever patient comes post hysterectomy, patient comes to you with any vaginal discharge, we do vaginoscopy examination by using our routine 4 mm ka hysteroscope. So many patient with 3 patient I have got even videos. There is a granuloma formation, and in one patient I removed gauze. Chronic discharge, always do vaginoscopy. If there is a repeated repeated infection, then you have to do vaginoscopy even in young patient. There was one patient which came from Rahata to me. Dr. Nitin Ghorpade referred her to me. Her discharge is not disappearing. Patient was just a 28-year-old. What we have done vaginoscopy, and what we found is there is a band between posterior vaginal wall and posterior cervix, and there was a pocket formed there, and it was like a Colgate paste. When you press, it is coming out. So what we have done is just resected, and we have given her laser, and patient did well.
Okay, great.
What about overactive bladder disorders?
Overactive bladder can be managed with this high-fem, madam. How it is managed is I already told you the reflex.
Yes, that case.
It will correct that reflex, and if it is not managed, put intravesical PRP.
Okay. Sir, in your patients which you treated, any of the patients did ever landed up in urinary retention after thread treatment?
Yes. One patient came today with urinary retention.
So how do you manage that, sir?
See, what I have did is just did catheterization, and patient just I have admitted the patient. I will discharge her tomorrow. Sometimes if you push PRP very fast, then some patient can cause this problem. And if you combine, some patient may get urinary retention even after high-fem.
Okay. No, sir, this was an acute urinary retention. Like later on in life, like there is some post-void urine which is causing UTIs in a patient. Like over-treatment, I wanted to ask you. Did you see any over-treatment patient?
No. But they claim the over-treatment with high-fem causes reflex relaxation of the pelvic floor muscle. So treatment to be adequate. Don't give over-treatment. 12 session is our protocol. Then we give gap every monthly or third monthly. She should come once in a month. Don't give over-treatment. Otherwise, why it is called reflex relaxation of pelvic floor muscle.
Okay. Great, sir. Great. Thank you, sir.
Is your treatment useful for cases of recurrent vaginal irritation and itching?
Yes, sir. In postmenopausal cases, yes.
How do you treat these patients?
Sir, we give laser first and we inject PRP there.
Yeah.
The mucosa becomes excellent. It becomes very pink, and it will become like young mucosa. I have photographs of such patients. One doctor's mother came to me, and she is having very good results. Continuous burning, itching sensation postmenopausal patient, they are having excellent result with PRP and laser, diode laser. But you buy machine diode laser with the already protocol, already the setting should be there. Okay, like I have photonics ka machine which is having setting. First setting 6 watt, 600 joule. Second setting 7 watt, 600 joule. Likewise, you have to buy the machine like that. Don't set always. So that is an old type of machine.
Great inputs. Thank you so much.
Any other questions? Anybody? Okay.
Hello.
Yes, sir.
Yes.
Sir, good evening. Dr. Mohan Pawar.
Namaste.
From Nanded GMC.
Hari, Hari, Hari.
Really nice to see you after long 23 years.
Yes, sir.
And
yes.
you are like doing everything. Actually, I like that you are using all technologies with small provisions mixing. So it's giving really quite good result. So all lectures are going nice. All many new things are there for us to practice. So actually, Kiran sir is there. I think,
yeah,
sir, there is a request. Actually, if you can arrange at least 1 or 2 days, some practical, not maybe hands-on, but at least as an observer.
No,
we are really difficult.
We are working out with that with all the people who have got their own centers, because for the information of many people, we had as we have the IVF program running. So ABCDI, that is anybody can do IVF. In that we have 17 centers all over Maharashtra who are training people. Okay, so the delegates gets a choice of where to go, and the entire cost is borne by AMOX. So the delegate has got a free hand where to go. For example, Chaitanya Shembekar is there in Nagpur, Dr. Balkaude is in Pune, Dr. Kundan Ingle and Kalyani Ingle are there in Pune.
Sir, I did that. Actually, IVF, I went to Nilesh Balkode, sir. So it was really nice because see, these all many new things are there. Just by listening the online lectures, it will be difficult for us to actually do it practically. So we want to see it at least once, then we can start practicing.
I understand. So, yeah. So we will work out something. There are many people who have their own centers. Rahul Yande sir is one of them, and if at all we can work out, because see, the problem with cosmetic gynecology is that the patients are difficult to get. Let us understand the issues of the center also. So the
even as a group, you can send us just to for observation also, because if you see
but
as a person, that
But
is
there should be patients, no, available over there.
From the point of patients, see, from the patient's point of view, we are infringing on their privacy. So anyway, we will work out something. काहीतरी करू. तुमच्या भावना पोचल्या.
Okay, sir. Thank you, sir.
भावना पोचल्या. तर कसं करायचं ते यंदे सर बघतील काय करायचं ते.
Rahul sir, one more question I want to ask. Whether you record each and every patient of yours, of SVI?
No. Record?
No, no?
Record of?
Recording of that, what you made videos, you do it for each and every patient,
not all,
photography?
Not all.
Not necessarily.
Some patient don't consent.
Okay.
No, not at all. Only few patients.
Because in our setups, we cannot do that. No, that's
no. What is problem is when I'm doing free, then I ask their permission, so they permit me. If paying patient don't give permit.
Actually, I'm still staying in Nanded. That's why I asked.
Yes.
Yeah.
So I'm doing free for some patients now. So from that patient, I got these videos. Otherwise, they don't give permit. And I don't ask also for private patients. Just I ask their phone, I record them and I give their phone to them, so that their recording will be with them. I cannot use this.
So, but medico-legally now it is very necessary to have the photographic documentation of cosmetic gynecological procedures. So what about that?
I don't have any medical legal case on me since last 25 years. Patient trust me, and if something happens, we will go from lower court to higher court. I have got insurance. They will see. 25 years, my career is just remained 20 years.
What actually sir is Yande sir is doing is, see, if the cost is kept minimum, then the issue of litigation usually doesn't arise. Now he is keeping it so minimum that I don't know, medical tourism will develop in Bid probably. I don't know what.
For sure. For sure.
So that is the kind of cost he's keeping. So I mean, many people are giving different ranges of cost. I mean, We don't blame them, we don't blame him, we don't blame anyone. But
Even
if the cost is kept less, of course, there will not be any litigation. If at all you see, त्या सरांचे मेनस्टे कोण आहेत ते ते ऊसतोड कामगार वगैरे जे आहेत तसे आहेत. आता ते काय लिटिगेशन करायला पैसे लागतात.
And again, they
2,000
will
रुपये
go
भरायला
into
बिचाऱ्या
SEY.
त्या माऊलीला जर पैसे नसतील तर ती लिटिगेशनच्या वकिलाची कुठे भरणार आहे पैसे. सो
anyway, without consent, I think we cannot record it whatever way.
Not record.
Anyway, any other questions? Chalo, if there are no questions, can we call it a day? Dr. Renuka? Anything that from your side you want to ask?
No, sir. It was a very good lecture, Rahul, sir. It's really great. And I'm really lucky to meet you tomorrow at Beed.
Yes.
So,
Achha.
yes.
We'll meet.
Good.
Yeah.
Chalo, Rahul sir.
Thank you, sir.
Yes, sir. We will talk at the end of the day or tomorrow. तुम्हाला मी स्वतः फोन करीन, तुमचा वेळ घेत नाही आता.
Okay, sir.
And thank you everyone. And
Thank you.
the greatness of
आमची
this
बायको खुश झाली. आमची बायको खुश झाली. चांगलं झालं म्हणते.
नाही. The greatness of this person is that he has made his wife join the course. I mean, Purnima madam.
I want to know what is going there. Because I also wanted to know कि क्या चल रहा है मार्केट में. हमको सीखने का है ना. हमको कुछ नहीं आता. We know only 20%.
I know. But then you did not join. You made your wife join.
कॉम्बिनेशन में ये फायदा है ना. एक ही ज्वाइन कर सकते.
सही बात है. So anyway, it's a pleasure for a person so down to earth like Dr. Rahul sir joining us, and thank you, sir. Thank you. I will speak to you today, tomorrow, day after tomorrow. वेळ मिळेल तेव्हा मी बोलेन तुमच्याशी. IIG कॉन्फरन्सला पण आपण बोललो. So we'll work out something for all these people. They are now you have got a 180 fan base now.
Okay.
Yeah, absolutely, sir. Absolutely.
चालेल. चलो.
Thank you, sir. Thank you so much. It was a great day. Thank you, sir.
Thank you, sir.
Thank you, everyone.
Thank you, Kiran sir. Thank you, Rahul sir. Thank you. Bye.
Thank you. Yes. Thank you.